Thank you for joining us for this most important health equity discussion today. I'm glad you're all here. This forum is part of the Health and Medicine Justice and Health Policy series. We hold, for those of you who haven't joined us before, we hold forums like these every couple of months, bringing together experts, advocates, community members to learn from one another, to talk to each other, and to promote solutions to address hard and persistent inequities in our city and around our state in particular. Health and Medicine was founded in 1981, for those of you who are not familiar with us, by Quentin Young, who is probably familiar to many. He was a relentless person in his pursuit of social justice in every realm, not just in health. He was a physician, but social justice to him crossed every group, every issue. And he was relentless in that, and he passed it along to all of us, the staff, the board, anybody who works with health and medicine. Our work is focused on the pursuit of social justice. We conduct research, we develop policy, and we're fierce advocates for health equity. I hope you'll visit our website and learn more about our many, many projects. I won't go into them today, but please do visit our website. I want to thank the Chicago Community Trust for their financial support of this series of discussions. We've been doing this for our entire history of health and medicine, all 36 years, although the last couple of years we've done many, many more. I also want to thank Loyola University, the Beasley Institute for Health Law and Policy, and the Civitas Child Law Center for their co-sponsorship and generous contribution of this space. This used to be a swimming pool, and that was a track to around. So we know that the floor is very well fortified under us. By being here today, you're now on our mailing list, and you'll hear about future forums, and as they're developed, we'll try not to bug you too much, but you will hear from us from time to time. Most of all, I want to acknowledge my colleagues at Health and Medicine and the Health Equity Initiative, Wesley Eplin and Tiffany Ford, who you'll hear from later, who really get all the credit for putting this together in all of our forum series, and you'll hear from both of them, but they're extraordinary people who run this center and do the research and put together forums and promote our Center for Health Equity. So I have lived in Chicago my whole life, as have many of you, and we've spent our lives here. We've seen gentrification in process. We've seen investment in some communities while we watch others be left behind. We've seen people displaced from their communities to make way for developments, shopping malls, high-rises, and more. You may wonder why we focus on gentrification and displacement. Why are these public health issues? I hope you're thinking about these questions, and I know that we are going to address them today. And knowing, just by being here, I know that you're thinking there's a connection, and we will all learn together about what those connections really are and how we can begin to address them. We at Health and Medicine have thought a lot about this and recognize that gentrification and displacement are serious equity issues that if we don't address, we will leave communities behind, and we will not have a healthy, robust individuals and communities and cities. So I look forward to our robust discussion. We will hear from many speakers and have as much time as possible for questions and answers. We know this is best done when we can engage all of our audience and the expertise that's in this room. We've designed it so that there will be plenty of time at the end for questions. With that, I'd like to introduce our moderator, Wesley Eplin, the director of the Health Equity Center at Health and Medicine, to bring us through the day. Thanks.
Can you hear me? Great. Great, so I'm really pleased to have brought together this discussion today to talk about this intersection between gentrification and health inequities in Chicago and beyond. So again, my name is Wesley Eplin. I'm the Director of Health Equity at Health and Medicine Policy Research Group. I'm also a Culture of Health Leader with the Robert Wood Johnson Foundation. I'd like to start out with some appreciations and a warm welcome to all of you. So again, I won't repeat Margie's thank you to Health and Medicine colleagues in as much detail, but just a big thank you to the team effort that goes into producing these forums. I'd like to thank the Chicago Community Trust for their support, their funding that helps us do the background work and put together these forums and gatherings and all the follow-up from them. Also, as Margie mentioned, the Loyola University's Berkeley Institute for Health Law and Policy and the Citizens Child Law Center. We have a couple of members of media in the audience, so thank you for being here and for your interest in this. And then, of course, all of our speakers and our participants, all of you, thank you for being here today. And finally, we have some Chicago Public School students in the audience as well, so I want to thank them for being here, their interest in this issue. Can we get a round of applause for our CPS students? As a quick agenda review, we're going to welcome right now. We'll hear a historical overview from Janet Smith from the University of Illinois Chicago, Voorhees Center. We will have a keynote address from Chloe Durensains, a quick break, and then hear a multimedia presentation that Tiffany has put together. We'll have some feedback from the field, so a panel discussion, followed by a Q&A with all of our speakers at the end. And so, I really appreciate Margie's starting to open some of these questions, but I'd like to put down a few more questions for us to consider today, things that I'm interested in exploring and things that others have brought to our attention in terms of this intersection between community and housing displacement and health inequities. So one obvious one is what causes gentrification, displacement. There are many for us to explore. How does displacement contribute to health inequities? What can people working in our various sectors do to prevent housing and community displacement? And what are some policy changes that can slow or stop community displacement? I think it's really important that we center our discussion in a root causes analysis. So, a little louder? Yeah. Thank you. Okay, so we're going to center our discussion in root causes. So really getting not just the surface level things that are happening, but thinking about what's at the root, what is underlying any given inequity that contributes to or results from displacement. Before we can do that, I'd like to put out a definition of health equity for our discussion today, and there are many definitions of health equity for us to consider, but this is the one that we've been using at Health and Medicine of late. This is Dr. Kamara Phyllis-Jones, former American Public Health Association president. She developed this definition and uses it, and I think it's really useful because it's operational. We can operationalize it. So she says that health equity is a process of assurance of the conditions for optimal health for all people, and she says that it requires at least three things. One is valuing all individuals and populations equally. One is recognizing and rectifying historical injustices. And the third one is providing resources according to need. I really think that each of these is really important. We can revisit this later, but I think all three of these, valuing all individuals and populations equally, recognizing and rectifying historical injustices, providing resources according to need. If we think about the process of gentrification, it does not do these three things. So root causes, historical and contemporary injustice. I think that we also have to have a historical analysis. So from my perspective, we have to go way back in history of our country that really was, going back to colonial America, was about displacing Native Americans from their land and moving them off of their land. And that Chicago was Native land as well. And so we're in a place where Native people no longer have been displaced from the land. So this is not a new phenomenon, displacement, and that's important for us to understand. And that continues to today in terms of oppression of Native Americans. So this is this top picture is from The Counted, from The Guardian. It points out that Native Americans are most likely to be killed in 2016 by police. And the bottom picture is from a story from In These Times, the same phenomenon. And again, it's really not new, and it continues to today. If we think about the Standing Rock Sioux tribe and the water protectors trying to defend their land and clean water and the right to those things. So This continues. It's rooted in the history of our country, and it continues to today. It's not new, and it's not limited to Chicago or the United States for that matter. And further, I think putting the question out there, how is racism operating here, is an important one. This is another question that Kamara Phyllis-Jones puts out there for us to consider for public health problems and health inequities. And further, how is capitalism operating here? Not just with regard to housing markets, but also thinking about thinking about wages and the like. We'll go into that in a moment. And then how is gender inequity operating here? And really, how are all isms operating in our society? I won't go down the litany of them, but we should put those on the table and think about those today and be willing to bring them up and speak about them. And really ask the questions, who is benefiting and who is being disadvantaged? Here's an example of how capitalism is operating here. This is the median hourly wage by race and ethnicity and by gender for Chicago in 2014. So you can see that the second set of bars is for white people, and the gray bar in that column, that row, is for white men. So you can see the results of both historical and contemporary racism and gender inequity and capitalism, the inequity bred by that, those systems overlapping in an intersectional way to oppress some groups and benefit others. And on a broader scale, just looking at the Gini coefficient across time from 1980 to 2014, you can see the gray line is for Chicago, the Gini index. That's indicating a larger increase in inequality over time. So we're more unequal than the United States as a whole, but both lines are going in the wrong direction if we believe in a more equal society. And then a few more questions to think about. So how do disinvestment and inequities in the public sector relate to gentrification? That needs to be across our sectors and within the public realm. So thinking about public education in schools, housing, public health clinics, public transit, and road maintenance, our tax code, which is very inequitable. Illinois is considered state and local taxes were the fifth most regressive in the nation. Policing and incarceration, and our immigration policies. And finally, redevelopment dollars. Tax increment financing is also very inequitably spent in the city of Chicago. The last thing I want to say is, before I introduce Janet, is for us to be thinking about a few tensions and relationships that I'm interested in looking at. And one is this idea of individual responsibility versus this being a collective societal problem. So certainly there's value in individuals saying, I'm going to try to not be a gentrifier, right? But any one individual effort might be mixed with the broader phenomenon continues of displacement and gentrification. So I wanted to talk about that. The human right to housing versus property rights is another tension that comes up in talking about gentrification, people's right to either rent or sell property at whatever price they want in a capitalist society. So that's another tension for us to think about. And then the human need for belonging, connectivity, and community versus a political economy that ascribes higher value to capital and people who have it. And so then, really, why are we here? And I think that all of you made a decision to spend your Friday morning with us, and I really am glad to see all your faces here. So thank you for that. I'll put forward that I think we're here because people's right to exist and be in community with one another is being called into question, not just by over-policing in our communities, which also is related to gentrification and displacement, but also people's right to exist and be in community is challenged by gentrification itself that pushes some people out of our cities and communities and allows other people to move in at will. So next I'd like to introduce our first speaker, Janet Smith. Let me find my sheet with her bio. So Janet Smith is a professor of urban planning and policy and the co-director of the Natalie Voorhees Center for Neighborhood and Community Improvement at the University of Illinois at Chicago. For the past 30 years, Dr. Smith's teaching, research, and community service has broadly focused on community development and local housing planning and policy implementation, with an emphasis on community-driven strategies to produce and preserve affordable housing. Research completed has focused on housing-centered projects that make linkages to disability, transportation, employment, the environment, and public health. So Janet, would you like to come up?
Does this one's not touching. Is it working? Can you hear me okay? See, that's it. Okay, it's on, they're hearing me. I have a loud voice though too. It's a village. Okay, I am going to give you a historical overview of housing and gentrification in Chicago. These slides will also be made available after this, so if you missed something, you will have the opportunity to look at it again. I want to start out with just giving you a little bit of background about the center itself. I've been affiliated with the Voorhees Center for 20 years. It's celebrating its 40th anniversary next spring. And these are just some of the things that we do. We work a lot on housing issues, also on the environment and economic development. But one of the things that I think is, I want to underscore is today that brings me here in terms of our expertise, I guess, is that we like to use sound methods to investigate timely problems in our communities. And we want to give data to people, especially who are trying to advocate for particular positions that sometimes are controversial, or as Wesley was talking about, that have these tensions, right? So we know from working with advocates, some of the people you're going to hear this morning, I'm thinking about Joanza and Coco and their work. If you don't have good data, in general, we want to have good data and evidence to have conversations. It's even more important when you're an advocate to have sound data that's defendable, and that's something that we pride ourselves on at the center. People may not like what they hear, but they'll never challenge us on the data, okay? So I want to start out also reminding us that Chicago is a city of neighborhoods. We pride ourselves on that. But also, as we know, we're a city of segregated neighborhoods. This is showing race in 2010, percentage of African Americans, the darker the red, the higher the percentage of African Americans. And for the most part, this shows concentrations of communities in areas that are 90%, even almost 100% African American. This is a pattern that exists now and has existed mostly for the last 30 years, 30 to 40 years, growing out from, if you know the history of the South Side, the Black Belt that was identified in the 1930s by the University of Chicago, and then what was known as the second ghetto, which is the West Side in terms of African American settlement, spreading after the migration after World War II. But one of the things that we've been concerned with is the growing inequality that happens in income. This is a map that shows income inequality. It's a particular measure and method that we use, borrowed from the University of Toronto, which has been studying the same question of income inequality in Canadian cities. What we do here is we look at, this is 1970, and the dark blue shows those people who have the highest incomes. They're above the city average, and those in the red are those that are below the city average, and those that are in the beige, which are kind of the outskirts of the city, are in the middle. And what this shows is a city that has, a kind of a mix. Actually, the dominant groups here are middle income and lower income, and the darker the color, by the way, either the higher the income or the lower. Okay, so what you see here is lower, moderate income families and middle income families. So the small band of blue, right, to highlight higher income families, and then some on the periphery. By 2010, it looks like this. I know everyone goes, ugh, because that's what you should do when you start to think about what's happening in Chicago. Remember the map I showed by race? We see this relationship. Fill in the blanks of where the non-blue areas, the red, dark red areas are. You now see all people of color primarily. So it's Latino and African American in those communities. So this is something we're very concerned with. And one of the things that we've been studying for a while, because communities have come to us and asked how do we understand it, is gentrification. And how does gentrification tie into producing these kind of results? So just to be clear about a definition, gentrification is a particular kind of neighborhood change that leads to displacement effects. And I think the important thing is the displacement. And that's what we want to talk about, and how that is becoming a health issue. This is an image, by the way, from a development up in Logan Square, where there's a lot of fight and push back against the gentrification that is happening and the sort of massive development changes that are happening. But one of the things that people ask now is gentrification just urban change? Is that just what's happening? It's happening around the world. I have students come and study with me who are studying gentrification in Korea. They're studying gentrification in Europe. They're studying gentrification in South America. So everyone's like, well, maybe it's just urban change. And if you know this picture, this was a controversy this summer where a building was bought in Pilsen, and the renaming of it was going to be redeveloped. They were going to call it the Gentry. And the neighborhood pushed back. It's not being called the Gentry anymore. But it seemed to be a slap in the face to people in Pilsen, especially if you know the Pilsen Alliance, which is an activist group pushing back and has been fighting against displacement and gentrification for nearly 40 years, actually. I mean, in that community for the last 20 years as an organization. So we have to ask this question, what's different now? And so I think a lot of it has to do with the mass movement of people that's happened, the fast movement of people that's happened, and then how it's happening. And so that's what I want to give you that overview and the history of that. So this is a cartoon. Sometimes cartoons aren't that funny, but this one is meant to kind of use humor to display what we call the different waves of gentrification. So it used to be called the Back to the City movement. In this picture, in this diagram, they kind of talk about the different waves of people who have come in and created gentrification. And what we see happening is a change over time. So in the first wave, we think about the communities that were working class minorities. They're being replaced by hipsters. Used to be yuppies, and is that we see yuppies referenced earlier there, but yuppies, young urban professionals, right? So we see this replacement of the working class with newcomers coming in who are looking for a hip neighborhood to live in. And it's usually because it's affordable too. What the next phase talks about then is the hipsters being replaced by the techies. And in this case, it implies, because of being in tech, that they have a higher income. And so they're replacing the hipsters, and the hipsters have to move somewhere else, right? So then, in the next wave, it gets even more higher up the income chain, and it gets more corporate. So what you see is techies are displaced by bankers. Okay, so now we're talking about people who are in banking, but also banks themselves, not just the bankers, but the investment, right? So this is about investors. This is not necessarily about the people living in properties. And you see then this, sort of the next phase gets even into what many refer to as what we're seeing now, where you have international investment happening. People coming in with money, looking for a place to buy an apartment, or to buy a condominium or a house. They may or may not live in it. The stories are, in New York City, the oligarchs from Russia come in and they buy a condo because they might shop once or twice in New York a year. Okay, so we have this, and it's also about investment to sort of hide your money, and this is a very interesting topic in this day and age, but in terms of ways to hide your money so that you don't have to pay taxes on it. Okay, so it has nothing to do with the house and living there. It has everything to do with value and increasing in value and finding a way to put your money into real estate. So this is sort of the waves that we're seeing, and many talk about us being in this last wave. So, but looking back, how did we get there? How did we get there so that we could actually create this? This is a different cartoon. It's called The Vast White Ring Conspiracy, and it talks about how whites left, were living in the central city, and then they eventually leave. But then they come back, and what happens in between is African Americans move in, and then the city gets disinvested, and what you see then is it creates an opportunity for people to come back into the city and get land cheap or get housing cheap. It's what Neil Smith, who is famous for writing about gentrification, calls the rent gap. And there's a list of things here that lead to disinvestment that actually create that rent gap. The rent gap is, this is what it costs now, but I think I can get this much for it if I put a little, I clean up the floors, I put in some granite, things like that. So one of the things is redlining, and you may know there's The Color of Law, a book that's out, and I think that the author's been circulating the city this week. I'm talking about it, which talks about redlining, where banks just draw a red line around the area and say, we will not put money there because it's too dangerous. What's dangerous? Oh, the return on investment may not be good because black people live there, or people who are not white live there, or lower income people. There's different reasons, but it's usually color. We also saw urban renewal, which Chicago is famous for, which really tore up the south side of Chicago and the west side, and didn't necessarily replace housing that was torn down until just now. So we've cleared land like 50 years ago, 60 years ago, that now is just getting rebuilt on. Suburbanization, so that movement out, what we see the white flight particularly was identified. Neoliberal policies, which is about privatization. And we see that in public housing, so we see it in other kinds of what used to be public resources are being privatized. And then we can also think about globalization, because that really has to do with the capital, the money, and the sort of flow of money. So the next thing, though, is when we have disinvestment, the question is it reinvestment or is it gentrification? I put this picture up purposely. If you know, does anyone know where this is? It's Google, right? It's the Google. And it's the Morgan Street station. And one of the things that people are talking about now is what a major factor in gentrification is transportation investment. This is, I think, a $26 million investment for this station, using tax increment financing, if you know. And it was obviously put in to accommodate the growth that's happening, the crazy growth that's happening around the Google. But it's also seen as maybe an incentive for people to move into this neighborhood, into housing. So this used to be an industrial area, also the meatpacking wholesalers, and now it's turned into expensive condos, luxury shopping. Great. So the question of that, how do we know? So one of the things we talk about is displacement, and I'm going to go through some data quickly, but let's talk about displacement. This is a definition that helps for us to think about it. What happens to describe displacement is things that happen which are beyond the household's reasonable ability to control or prevent. It occurs despite the household having met all conditions of occupancy, so that's if you paid your rent and still you get displaced, what can happen is someone raises your rent. They raise your rent a lot and you can no longer afford to live there. So you're paying rent, you're doing all the things to be a good tenant, but now your rent's going up because the landlord wants to raise it and think they can get more money. And if you can't pay for it, somebody will move in. And also it can be about making the occupancy by that household impossible, hazardous, and I said unaffordable. We can also see things that are done in terms of the quality of the housing. So disinvesting in the housing so that people can't, it becomes uninhabitable for them to live there, move people out, and then you fix it up. So there's a lot of things that we can talk about in displacement. Even more detail, and I don't have time to go into these, but I want to remind people that what we've been looking at in terms of understanding displacement isn't just raising rent, it's other strategies that have been used in terms of formal evictions, informal evictions, but then we can also go into things like not letting people move in with a voucher. Okay, so we have evidence in Chicago that there's discrimination against people trying to use vouchers, based on race especially. So we can think about that and other kinds of things. Foreclosures obviously was a big issue, and we still see that being a factor for people. The other thing is that gentrification is about power, and that about being able to displace people physically is one thing, but also making people feel uncomfortable in their own neighborhood, or harassing people. If you live in Pilsen, does anyone live in Pilsen? Anyone get phone calls or letters left on your door from developers? There are a lot of people I know who do that, who get that every week. So they're being pressured. They're being said, you're not welcome here. I think that's what we have to think about, who has that power. So it'd be easy if signs like this were posted and we knew gentrification was coming. But it's not, okay? So instead, what we did is we developed an index to describe gentrification using data. We actually used data from the decennial census, so we documented the changing stages of changing gentrification around the city since 1970. This is a map showing from 2010. In simple terms, there are 13 variables. We score them. The higher the score, that is a 13, the higher your level of gentrification. It's using these measures, and they're typical things about change in the population in terms of race, in terms of age. Gentrification usually kicks out young and old, okay? So you see a decreasing aging population and a young population. You see higher education, you see higher home ownership, higher income, lower poverty, these kind of things, right? So what we did here was model this out, and this is from 2010, and what you see is the darker the orange, the higher the level of gentrification. The higher level of gentrification, by the way, the orange, some of those are a total 13. What we would call Uber gentrification, not to be mistaken with Uber the car, but Uber, like extreme gentrification, which is another term people use. So let's just look at this over time. And I know the maps are a little small, but what you see is if you just think about the colors, you see the shift, right? From 1970 to 2010, what we see is the shift from the middle income and upper middle income families of Chicago being primarily on the outskirts to now being concentrated wealth, if you will, on our north side of the city, and it's still in some pockets of that. And what you see in the data before this, below this, is actually just showing that the shift from that middle income and lower income families that we had, that were sort of more towards the middle, to being to the extremes. So now we have nearly 40% of our families are in the extreme high-end gentrification, and nearly a third are in the low extremes, okay? So, can I have two? So population has changed over time as well. And this is a little tricky to read, but what we're seeing is a sort of a thinning out of the south side of Chicago and the west side. This may not be a surprise to some people. I'm not putting the race up here, I'm just showing the population. But if you know what happened between 2000 and 2010, 200,000 people fewer in Chicago, 9 out of 10 of those people were black. And most of those came from the south side of Chicago and some from the west side of Chicago. And a fact that isn't known or not talked about is out of 200,000 people, 130,000 were under the age of 18. This was kids just saying, hey, I'm getting out and going to the suburbs. These were families leaving. Chicago has lost families. We have more dogs than we have kids. Income is shifting as well. This just kind of reminds us of what I showed earlier in terms of the income inequality. This is interesting. Poverty has also changed. It's still concentrated like we were showing before, but we're starting to see a thinning out even. And that makes us concerned about who's able to live still in the city. The right to the city, not just a right to housing, but a right to the city is being raised. School-age children. Now this one's a little trickier to read because the colors might be opposite of what you think, but the darker the color means the fewer the children there are there. So where we're investing in schools and where we're disinvesting in schools is contrary to where the children are. We're closing high schools in Inglewood next year, but we have more children there on the south side than we do have on the north side. Okay, so that's something to think about. The last thing I want to leave you with is sort of this image of gentrification over time. This is looking at over 40 years, how do we classify our neighborhoods in Chicago or community areas. So what you see is, you see the green refers to those areas that have gentrified and over time have stayed at that level of gentrification. What you see in the blue and the brown are those areas that have not improved. And in fact, they have had long periods of disinvestment. Okay, so the brown in particular in terms of disinvestment and serious decline in their scores, so they're getting worse over time. Next to it is a map of segregation. Now this is a different type of map. It actually breaks out race by dots to show how many people are. It helps us to see where there might be racial integration. We see it in a couple places. We see it a little bit still up in the north side, up in Rogers Park. We see it in down in the Chinatown broader area down there. And we see a little bit down by University of Chicago. For the most part though, the rest still stays the same, right? We have concentrations of whites, concentrations of blacks, concentrations of Latinos. And when we see this pattern of where whites live and where gentrification is, that's what we're trying to make those connections. So the last thing I'm going to leave you with is something you can look up yourself on our website. We said, sure, we can identify gentrification, but what are we going to do about it? That's what people really care about. So we developed a toolkit. It helps you to think about at what stage of gentrification. I will always say, no matter what, always talk about building coalition and working together to figure out how you're going to offset some of those things that we're seeing in terms of potential displacement in particular. So with that, I'm just going to leave this up here, and thank you very much.
Next, I'd like to welcome our keynote speaker and introduce her, Chloe Gurin-Sands. Chloe is an associate at the Metropolitan Planning Council, where she works to bridge public health and urban planning. Her primary projects of focus currently are the cost of segregation, Great River Chicago, and the Community Development Health ROI project. Her professional interests revolve around the relationship between the natural and built environment and health, and integrating health equity into planning and policy decisions. Chloe received her master's degree in public health from the University of Illinois at Chicago. While attending UIC, she completed her practicum with the Adler University Institute on Social Exclusion, working on a health impact assessment of converting a portion of the former Fisk and Crawford coal plant sites in Chicago's Little Village and Pilsen neighborhoods to green space. Her master's capstone project examined the potential health benefits of improving urban blue space through the Great River Chicago initiative. Chloe also served on the leadership team of Radical Public Health, a student organization that aims to address the root causes of health inequities, such as structural racism and class inequity. With that, welcome Chloe on up.
All right, good morning, everyone. Thank you so much to HMPRG for inviting me to be here today, and also to Janet for such a great overview of, the issue at hand here. So let's jump right in, gentrification and public health. So I would like to start with a personal story about why I came into public health, why I care about displacement, and an experience that really made this viscerally real for me. I was in high school when Hurricane Katrina hit New Orleans. The next spring, my best friend's mom, who was then the service learning coordinator at my high school, started running work trips to New Orleans. In 2012, I had my first opportunity to go on one of these trips as a chaperone. We worked in the lower 9th Ward Village, which is a community center in the 9th Ward that was started by folks that lived there. The lower 9th Ward, as I'm sure most of you know, was one of the places that was most devastated by the aftermath of Katrina and is still grappling with that today. So while we were there, we talked to people. Everyone had a different opinion about what happened in the aftermath of the storm, why the community had not still been restored, but everyone agreed on one thing. No one was really helping people who had been displaced come back. And so in the community center that we worked in, they had a big map up on the wall that showed where people were sent as refugees during the aftermath, and they were trying to track who would come back. And by their estimations, only about 5% of their neighbors were back in their homes. And so they viewed this really as one of the main reasons why their community, could not get back on its feet, a purposeful keeping these people out. The last time I was in New Orleans was in early 2015, 10 years after Katrina hit. A lot had changed in the 9th Ward between 2012, 2013, and 2015. There is now a grocery store, they were putting in a bank, a firehouse, they had a new Head Start building. While these are great investments, they appeared abruptly over the period of a year, after not being there for 10 years. When I asked friends there why they thought the investment was coming at this point, their answer was, well, it's been long enough and now they know that people aren't coming back, so they want to start attracting new people. So going to New Orleans is one of the things that really solidified to me that public health was the right choice for me, and that I wanted to use public health to frame the experiences that I had in New Orleans and other places, showing how displacement, other, this is a different type of displacement, but similar effects, but how putting inequity into all of our decisions happens and how we can reverse that and work on those power dynamics. So now I work at Metropolitan Planning Council here in Chicago. MPC is a nonprofit, non-governmental civic organization that focuses on issues related to urban planning. So housing, transportation, land use, your kind of classic elements, as well as natural resources such as water supply and rivers. More and more, our team is grappling with how to minimize displacement in our work. So often our work is about improving communities through job opportunities, transit, smarter development and growth, improving natural assets. However, we know, and as Jan just said, these types of investments are triggers for displacement. So how do we continue to work towards what we really think are things that every community deserves to be able to have, and so that people don't have to say, no, I have to turn down an improvement to my life because then I won't be able to be here to experience it. So how does gentrification affect health? So gentrification, Janet and Wesley both gave kind of definitions of this, but wanted to reiterate. So reinvestment into a devalued neighborhood to create new residential and commercial infrastructure for middle and high income residents. I like this definition a lot because it talks about reinvestment. It talks about that the purpose is for infrastructure geared towards middle and high income residents. And then I want to make clear that I'm also including displacement in this definition. Not all definitions of gentrification do, and so consistent with what Janet said, you know, we really are focusing on gentrification that leads to displacement. Gentrification can happen with or without a racial shift, although a lot of times we do associate it with a racial shift in our minds. And then, you know, it's often due to economic, cultural, and social pressures, similar to what Janet laid out. It's not always those strictly economic things, but it's also other pressures about getting people out. And displacement can also happen without immediate gentrification. So things like we see in our, you know, largely Black communities here in Chicago, years of disinvestment without this reinvestment and people moving in. That can happen later, but doesn't always happen, right? So why is this a public health issue? 33.7% of Chicagoans are cost burdened on their housing. So what that means is that they're paying over 35% of their income on housing costs. So this is not only about individual choices, but this is about population patterns, the policies and underlying structures that are going into creating this issue. Since this is an issue not only in Chicago, but also in our region, as we're seeing the suburbanization of poverty and increasing poverty in the suburbs as well, we really need to think about this on a regional scale as well, and not just our neighborhoods, not just our city, but what's happening beyond that as well. So factors related to gentrification, Janet went over a lot of these, but so communities with an underlying history of disinvestment, devaluation, deterioration, all of this sets the stage for either displacement on its own or, you know, immediate gentrification and on a more rapid scale. In the short term, communities that may be disinvested but still have assets, such as a strengthening market, cheap or historic decent quality housing stock, or spatial assets such as being close to a downtown or an employment center, are obviously at higher risk. So race is a factor in a very interesting way. In Chicago, so our Metropolitan Planning Council's Cost of Segregation project recently found that in Chicago, gentrification in this classic way happens more in Latino areas than in Black areas. So if you think about that kind of rapid scale, people moving in at the same time as people are moving out and sharing that space for a time before people are moved out, that style of gentrification happens more in Latino neighborhoods, whereas in Black neighborhoods we see more of the long-term disinvestment over time, people not moving in at the same time, which in our opinion has a lot to do with racism and folks not wanting to live with Black people at the same time. Get rid of them first and then move in. And then renters are more at risk because of higher pressures on rent and not being able to control those forces. So a lot of times these are populations that are already experiencing discrimination along these demographics and therefore already facing health inequities because of those. So health inequities, or sorry, health outcomes of displacement. So of course there's physical and financial health effects, further difficulty finding affordable, healthy housing, right? So you may be forced to move somewhere where the quality is worse than where you were. This can mean buying or renting even older housing stock, for example, that might have lead paint or pipes or radon. Beyond potentially being forced to move into worse housing conditions, you can also be temporarily or permanently homeless. As folks move further away, they may also face inequities in transit, job, and commute options. We know that not being able to find a job will affect financial security and in turn health. But an added layer to this is that even if you do find a job or are able to keep your original job, you now have an inequity in your commute. Longer commute times are associated with increased stress, lost sleep, increased fast food consumption and snacking, and a whole lot of other not great things. Similar to the issue of housing stock, when moving out, when people are displaced, they may be forced to move into areas with more environmental hazards, areas that are closer to industrial corridors with heavy truck traffic, for example, close to a power plant that's releasing emissions. These types of exposures can lead to conditions such as asthma, increased respiratory conditions. Gentrification can also lead to less access to services and institutions. So if you're displaced, you may have to move further from where your services were, or your services can get pushed out of your neighborhood, even if you can stay. So this can include healthcare services, education, of course, and cultural institutions as well. Social and emotional health effects, which we know are not completely separate from physical and financial, but that would be a very long slide. So stress and all of its kind of things that come from that. Gentrification and displacement are disruptive. The processes, whether folks move to worse off areas or not, can lead to more stress, violence, and injury, and just mental health issues in general. Policing is an issue as well. So the Economic Opportunity Institute stated that when new wealthy residents move into poor neighborhoods, arrests and citations for trivial offenses increase dramatically along racial lines. And then social and cultural loss. So if you're breaking your social ties, your network is getting disrupted and moved around, you're potentially going to have that feeling of loss of your community, your culture, and your actual network. So it's also complicated, right? There are clear and real harms that come from displacement as a function of gentrification, and yet nobody wants to live in a disinvested neighborhood. Well, people want to live there, but nobody wants their neighborhood to be disinvested, right? So gentrification is often conflated with any type of investment. It's easy to understand why, as we just saw, because many investments do carry these triggers for displacement. And we've seen it play out so many times like that. And we're not doing a very good job of it not playing out like that. So then we get to this place where we want to improve communities, but don't know how to do so without displacing people, and so we're at a standstill. But the solution cannot be that we do nothing. The solution can't be the status quo, people staying in areas that are just as unhealthy for them. So it's complex, but neighborhood changes don't have to mean displacement. Some studies show that there's possible to have a decrease in poverty rate of a community without displacement, and suggest that class changes, if done correctly, could actually be protective against the poorest folks moving out. How could that be possible? So an example, not that this is happening, but an example where you could conceive of this is in an area where there are a lot of vacancies. So somewhere like North Lawndale in Chicago. People can move in, and if you effectively handle that transition and adapt for it and put protections in place for the people that are there, bringing in new resources that have been much needed can improve the quality of life for people that are there, if they are able to stay there. The cost of segregation project as well also found negative effects above and beyond just kind of run-of-the-mill, quote-unquote, discrimination that can be attributed to living so separately, so spatial, racial, and economic segregation. So how do we create spaces where we're actually living together, so where it is actually about wanting to live there and not just use the property for something else, where we're having real meaningful interaction and inclusion and creating real sustained mixed neighborhoods without that being a stopping point on the way to displacement. But then there are still cons of neighborhood change without displacement. So can still be the social loss and cultural and institutional loss. So if you think about a neighborhood where even if people aren't displaced, but then the percentage of low-income people is much smaller, some services may feel like it's not worth it for them to be located there anymore. Loss of resources and services, and then political shifts, which Janet talked about as well. So, if you have a new demographic coming in and they then have more power over decisions that are made in that neighborhood, how do we protect against that? So, as I said, we have to do something, but how do we do it better? How do we learn from the mistakes that we've made and keep making so that we can continue on this path? So measuring our progress on health inequities in the face of displacement and gentrification. The key questions that we need to be asking in public health, when we're looking at health outcomes, we tend to look at things in terms of an entire neighborhood or community area, or the population by a demographic or characteristic. In community health inequities across community areas, neighborhood shifts, displacement have the potential to confound improvements that we might see. For example, if we're only looking at whether there's a shift in, for example, childhood opportunity index over time in a neighborhood, but not actually keeping track of who's in that neighborhood, then how do we know that things are getting better for those people? If we're not keeping, on the programming level, if we're not keeping track of where people are moving, then we're not adapting our services to meet need. For example, the Latino population around O'Hare is growing, while the same population around Pilsen is getting smaller. However, many services haven't figured out that change yet, or don't have funding to extend another site, or don't have the bandwidth to move. So we're not providing services and adapting to the effects of displacement. When a community, some of the questions that we need to answer to know how to handle this better. So who is leaving and who is staying when a community turns over? Where are people moving when they are displaced? So when people move out, is it by choice? Is it because of these pressures? And where are they actually going? Is it a place that's where they're better off, where their situation is pretty much the same, or where things are worse for them? And when a community becomes mixed income, are the health benefits due to improved health status of the families that stayed, or because there's just a different set of people there now in a different mix? And I would say these are things that we don't necessarily understand very well. So while there's some academic work that looks at these kinds of considerations about specific time periods, and some of that is being considered in terms of analyzing housing, transportation, and other planning policies, we're not integrating this type of data regularly into our public health knowledge. So we need to start doing that. So some of our opportunities to do that are things like, the IPUMS database that is actually tracking where people are moving. That is unfortunately on, well, not unfortunate, but that tracking is on the city, county, and metropolitan statistical area levels right now. Unfortunately, we don't have that data on the census tract level, so we aren't necessarily doing neighborhood analysis and tracking shifts on that level. Still, tools like this can be useful in tracking shifts to where people are moving and trying to understand on a regional level or a city level, county level, where people are going. We can try to tie this to our public health data and use tools like the Voorhees Center tool and the data that is out there. Epidemiologists, we really need your help figuring out how to tie all of these things together to the data that we do have. So what can we as health professionals do beyond trying to learn more about this? So the first thing is community engagement and knowledge building. Knowledge building being for ourselves as well. So health folks, we should be participating in the creation and process of knowledge building strategies and tools. Bringing both the positive and potential negative health effects of investment into the conversation is really important. All of these strategies and policies can use a health in all policies lens, and including the strategies that I'm going to talk about in a minute, and bringing the social determinants of health to the forefront of why we're advocating for certain policies and practices. So genuine community involvement and community-led involvement is extremely important, but it's not enough, right? So one, for it to really help, it has to be genuine. People have to be in leadership decisions about decision-making, leadership positions about decision-making, not just a courtesy, what do you think about this? But also when you get community input, the reason I say it's not enough is that while it's important, it's not always enough to change these discourses that are happening at a higher level or these things that are out of people's control, right? Policies and things like that. So while it helps to have, what does the community actually want to see come in here and have that in conversations, there's some, stronger things that you can also try to do to force people to adhere to what the community wants. So equitable investment. So one thing is helping local businesses and homeowners prepare for change. So one example of this is IFF, who is trying to start helping businesses and homeowners actually be able to have money to stay up to code so that when that policing and enforcement starts changing, they'll be less likely to be dinged for those types of things. Because equitable investment also means investing in capacity and preparation and adaptability and resilience, not just infrastructure. So that goes along with understanding these triggers and planning in advance. The Neighborhood Opportunity Fund is one example of how leveraged funds from booming parts of the city can be somewhat redistributed to start helping areas that may need it more. And we want to make sure that we're continuing to consider helping businesses as part of that. And then continuing to build affordable housing using inclusionary zoning strategies and upzoning for density, those kinds of things. So we have a new affordable requirements ordinance in the city where pilots are being run to actually significantly up the requirements for on-site affordable housing in both gentrifying areas and already existing strong markets. And then the role of anchor institutions, since we are health folks, a great example of anchor institutions is hospitals. There are hospitals in the city that are starting to think about how do we build affordable housing on the land that we own. How do we start investing in neighborhood infrastructure by using, our tax exempt dollars to go towards this kind of thing. And then, of course, there's housing cost options. So these other things try to help strengthen, some of the other factors that are going on, but we could put in some controls that actually just directly affect housing costs. Like Leslie was talking about, thinking about, what is the right of somebody to sell their property for as much as they want to versus the greater good. So things like rent control, property tax freeze, progressive income taxes that are starting to be discussed, trying to figure out how to make those politically feasible in our state and in our city. And, so as public health people, whether it's part of your job or it's just something that you're doing on the side, as if the two are not related, but we've got to start looking into what these policies are, what they mean, learning more about them and signing on to things if we're in support of them, or going and making the case about why this relates to health. And then, as I mentioned before, taking that regional approach and not only focusing within the city, because what we do in the city does affect the rest of Cook County and as well as our neighboring counties and ripples out from there. So that is it.
We are ahead on time for once, so that's a great problem to have. So I was wondering if I could just put it out there if anybody has a question right away for Chloe. You can kind of open that up.
I'm Kathy Powers, and I'm a member of the Northside Action for Justice, and we are now petitioning the state to get rent control. It has to go through the state first before it goes through the city, because rent control is banned in Illinois, as well as a lot of other states, thanks to the Koch brothers. I have to throw that in. We are petitioning in Uptown particularly because we have a lot of problems in Uptown as far as gentrification and displacement, and no efforts for relocation by the city. Extra policing, like you said, really, I don't know. In Jefferson Park, the alderman has decided and turned around what was going to be a public storage space, which is a big block of building where people put their stuff and never look at it again. And he wants to build a multi-level affordable housing building for disabled people. Unfortunately, I've been to some of these protests. There are three thoughts on this, and one is all in, and I just explain that. And then there's a neighborhood who they only want it to be 4 stories, not. And then there's the skinheads who want a public storage space there. They don't want those people living there. So I just wanted to bring that up. And you're right on cue. Thank you.
Question over here.
Hi, I'm Lakia. I'm currently serving in National Health Corps Chicago, and I'm serving at Trinity Hospital. And a lot of my patients are asthmatic or COPD, and I want to know how I can connect with them better, like using a language that they will understand so they can better help themselves. Because with us being community health workers, our goal is to help them with their housing, whatever, if their lights are about to go off, they're not worried about why they can't breathe. They're worried about how they're going to pay that light bill. So what we do, that's how we help them, but I also want to know how I can better, educate them, just using a language they can understand.
Hello, okay. Well, that's a great question. Let me ask a follow-up question. Well, first, I'm definitely not a clinical person, so if there are clinical folks in the room that definitely have more experience working one-on-one with community members in this setting, feel free to commandeer the mic and give an answer as well. But my follow-up question is, what piece of it do you feel like they need education on, or they're lacking, or when it's something that's causing the asthma that's out of their control, do you want them to understand that better, or do you want them to change their health behaviors around, using an inhaler?
It's mainly like their health, their medications, for example. Like, why aren't you compliant? So just trying to get them to be more compliant with taking their meds. And I'm always an advocate for use your spacer, you get 80% of that, and a lot of them don't have spacers. So, but that's another story with the physicians and everything. But it's usually them not being compliant with their medicine.
Yeah. So one thing that we know is that, if you don't have your other needs met and you're having trouble with, like you said, paying the rent and paying the bills, that it's just a lot harder to keep up with your health stuff. And it's not always necessarily a question of education or not knowing what you're supposed to be doing. So not this past APHA, but the one before that, I went to a really interesting presentation about adults with asthma. It's genetics, so a lot of their kids have asthma as well. And so they'll come into the ER for early refills on their, their kids' inhalers, because their kids are covered by insurance and they're not. And so people assume, all right, the parents don't know how to use the inhalers and they're just using it wrong and using it too much on the kid, when actually they might also be needing to use it because they don't have one. So there's a lot of other kind of roads for investigation into what's really going on. And I think just being, honest and open about that on a human level, and saying, we've had these conversations about why or what you're supposed to be doing. Is there something else going on? That
It usually is.
yeah.
Thank you.
Hello, how are you?
Good, how are you?
Wonderful. My name is Melvin Thompson. I'm the executive director of a nonprofit on the south side, very far south side, in Washington Heights. And while I know gentrification has certainly public health implications, you mentioned that doesn't happen. It happens typically in Latino neighborhoods. Well, south of, I'd say, Woodlawn, Black neighborhoods aren't experiencing gentrification at all, basically, for the most part. Yet we're suffering from tremendous disinvestment. To me, is a much higher public health issue than the gentrification of areas where we're not really there. So I don't know if it's a question, just more of a statement, and shouldn't there be more focus in areas where there's a lot of disinvestment, where you don't have the migration of people leaving and new folks coming in. Janet mentioned a train station around Google of 27 million. We've got one at the Red Line at 95th and Dan Ryan, 300 million. But you don't see the investment that you're seeing around Google. So
Yeah.
just an observation.
Yeah, definitely. So at the beginning, when I was talking about this displacement and gentrification, while they're oftentimes conflated, there definitely can be this type of disinvestment, and even if people aren't getting pushed out, in kind of a specific way, just taking all of the resources away from a community, and that definitely has extremely devastating health effects, right? So I would say, yeah, it's extremely important to focus on that. The topic at hand was gentrification, and so I don't think that, it's more important or less important, but yeah, that's one of the things where you think about, when I said like keeping it as it is and keeping those neighborhoods that are being so disinvested and just abused as they are is not an option. But then how do we get around the potential fears of, if we invest there and if we take the time to really, one, value the people that are there, their intrinsic value and not just valuing them for potential growth opportunities. What can that look like and how powerful can that be if we start investing for the people that are there, not necessarily with the mindset of, we want to grow the heck out of this place, but just making it better for the people that are already there, but while still protecting against what could possibly happen. So yeah, great point. I agree with everything you said.
I just hope there's some kind of dual strategy.
Yeah.
Going on in heavily populated areas where you're not seeing gentrification, while at the same time dealing with that. If folks are leaving those areas, we can use them.
Yep, definitely. Yep.
Great. I think we're going to stay ahead on time, and we will have more time for Q&A discussion toward the end of today's program. We're going to go ahead and go on break. We have about a 20-minute break, 15 or 20 minutes, so we'll reconvene around 10:45. So for the next part of our program, we're going to have a brief, well, not so brief, we're going to have a panel discussion with three folks who work on gentrification and displacement in Chicago. So I'd like to invite those three panelists up now, if you'd like to come up to the front table. All right, so I'm going to do some brief bios for our speakers, and I want to thank them for being here. So first, to my right, we have Roxanne Smith. Roxanne Smith is a grassroots leader and member of Communities United. However, Roxanne worked with Communities United and their parents throughout the winter's Organizing Ourselves to Stay initiative to transition her building into the hands of a mission-driven developer that is keeping her rents affordable. Roxanne has been a key part of expanding routes to preserve affordable housing and gentrifying markets in Chicago. And when we get to it, we'll ask her to share some of that experience of how she got into this work. Next to her is Jawanza Malone. Jawanza is the executive director for the Kennywood Oakland Community Organization, COCO, on Chicago's South Side. COCO is one of the oldest membership-based grassroots community organizations in Chicago dedicated to serving low-income and working families. Founded in 1965, COCO has a dual approach to community engagement through both community organizing and social service delivery. COCO's organizing focus is directed towards equitable education, affordable housing, youth investment, and senior engagement. Next to Jawanza is Juliet de Jesus Alejandre. Juliet was born and raised in Chicago's Latino Northwest Side and is a mother of 3 amazing boys and a self-proclaimed barrio nerd. As the Logan Square Neighborhood Association Youth Program Director and lead organizer, she works with brown and immigrant youth who form questions, solutions, and actions around the social forces shaping their lives, especially gentrification and education inequality. Recently, LSNA youth leaders fought and won for community-driven zoning process in the 31st Ward, co-wrote the proposed pilot act for the preservation of affordable housing in the 606, and are co-leading a process to develop a neighborhood plan for 9 local schools that matches the brilliance of the people of their community. I have another round of applause for our panelists. Thank you. So to start off, I was hoping that each of our panelists could spend about 4 or 5 minutes sharing kind of their background, what brought them into this work, and then what their main work is on this area of preventing displacement, housing and community displacement in their communities. And so I was wondering if Roxanne, would you like to go first on that? Great.
Hi, my name is, excuse me. My name is Roxanne Smith. I've been in the organization with Communities United. Actually, we are a social justice organization that engages in the community to make a difference. We also work on a wide range of issues, including affordable housing, and that's where I come in with helping with that situation. And I'm going to be brief, just saying that once I was a renter in a foreclosed building. CU, Communities United, they knocked on my door to engage me about my rights with this green bag and how I could work with them to stay. This wasn't to my wanting to move, I was forced. I was going to be forced to move. So in other words, it was just a threat of displacement, and it impacted me in a almost horrific way because I have a son who has cognitive disability, who's born with Fragile X syndrome, and one thing that they don't like is change. Not all this moving around mom stuff, you know. Okay, we're here and we're supposed to be here. You know, he'll got his toothbrush and pajamas and walked out the door. That type of thing. So it's a shocker. So even going through as a single mom and the guardian of my son, the mental stress of this was just overhealed if it weren't for prayer. Now that's my way. I'm just gonna say what I do, okay? And just unable to find anything on the block, everything being unaffordable, like $200 more. The price ranges were just horrific. To go from one place where you're at just to the next block, it's almost $200-300 more. And then you know you have to do first and last, of course. You've been with my family, we're comfortable, okay? And the goal of Roots, which is our organization, is just to help us to stay.
Tell us a little bit more about that.
Roots is an organization, an initiative led by Communities United that empowers renters, aims to bring other stakeholders like myself, and renters like myself, elected officials, developers, and others to keep people in their houses. That's what it's for. To improve their housing and keep rents affordable, because one thing we need is affordable housing. Rent control, I've been through that. It's over the hill. In 6 months, you're up again, okay? Our role is to engage the community and convene different partners to advance in this work. We have 2 4-unit buildings like mine, organized, and they worked with the developers, so they purchased the building, rehabbed it, and kept it affordable. So now I'm still there. Praise God. Now I'm still there. It was a fight because we had to fight against Fannie Mae, different people that have the money and they don't care about the building itself. They just want the funds, the finances. That's all they want to roll is the finances. Forget who's been there and how it's family oriented and the schools and transportation, so forth and so on. The things that you feel secure in, they tried to bring me down. But if one thing that I do, either I stand for something or I'll just fall for anything. And that's not me at all, okay? So we got support, and we also work with developers to preserve over 200 units in Albany Park, which is a good thing. It costs like 30 to 40% less to preserve and than to create a new unit. You know it's going to cost you more to build a new affordable unit. At the city, it costs over $300,000 a unit. We can preserve it for under $200,000 a unit. So I call that progress. Thank you.
Roxanne, thank you so much for that. One last question before we move on to Jawanza. Could you tell us what specific communities that Communities United is working in?
Well, actually work in the West Side neighborhood, Austin community, Belmont-Cragen, Albany Park, and I believe, is it the Pilsen or, no, not Pilsen. Okay, help me out, team. Homer Park.
I heard someone say
I
Hermosa.
believe that,
Hermosa or no?
no,
Okay.
just Belmont Cragen, Albany Park, and the Austin community.
Great. Thank
Yeah.
you. Thank you very much.
Thank you.
Next, we'll go to Jawanza Malone to share about Coco's work and kind of how he got into this work and what Coco does in this area of work.
Good afternoon, everybody. So the Kimball Oakland Community Organization has been around since 1965. I haven't. I came a little bit after that. I came to the neighborhood in 1997. Started working with the wonderful families there and learned the history of the neighborhood. In Kenwood is really where I learned that displacement and gentrification is not just a policy initiative, but it's a violent act. I have families share with me how their homes were burned down by the property owner because there was more value in the insurance money than maintaining low-income housing for Black people. And the struggle to try to find some place to live when you've lost everything in the middle of the night. And so as we talk about people being forcibly moved from their communities, their social networks that they created being ripped apart, there's sort of emotional trauma that is also associated with that. Young people being forced to go to different and unfamiliar schools, and the research shows that as you move a child from one school to another, they lose at least 6 months worth of learning as they're attempting to recover from that separation. And as we, on the heels of the announcement of additional school closures will take place at the end of the school year, we see this prioritization of profit, of uber profit, still in your terms, Dr. Smith, over people. And there's just something fundamentally wrong with that. And in a room of public health professionals and people who care about people, I think I'm in the right place this morning to have this kind of conversation. And so it's really learning from the people that moved me into a position to better understand this issue and participating in coalitions with some of the people that's in this room. My experience with understanding affordable housing as an issue really goes back to the Balanced Development Coalition that was formative in the creation of the Affordable Requirements Ordinance, the original version, before some of these newer amendments that I think actually help to gentrify our communities rather than help them. The Sweet Home Chicago Coalition, which fought to make sure a percentage of TIF dollars was designated specifically for affordable housing creation and preservation. We're part of a couple coalitions now, the Chicago Housing Initiative, which is fighting for CHA reform, which just a real quick story. We've been engaged in a campaign for 6 years now to bring necessary reforms to the Chicago Housing Authority. And in the early stages of the campaign, as we were struggling to get media coverage of the stuff that we were uncovering, like CHA getting money from the federal government for vacant apartments and money for demolished public housing developments for 10 years after they've been demolished and no longer exist and nothing's been rebuilt on the land. Reporters were saying back to us, well, there's no news here. CHA has been corrupt for decades. There's what's the news story here? And it's that cavalier attitude towards low income and working families that create the problems that we have in Chicago. And when you look at more than 80% of the residents in CHA being Black, it feels very racist in tone and in nature. Then the last thing I'll say is that we've been instrumental in forming a coalition to bring rent control to Chicago. Northside Action for Justice is one of the founding members along with us, and again, this is really to stabilize our communities, because our communities are churning and lives are being lost in the process.
Juwanza, thank you for that. One quick question for you before we go to Juliet. Could you tell us what we might do to support that, that campaign? What organizations might do to support you?
Sure. I think generally speaking, as public health professionals and people who care about public health, there's a moral obligation to really address what's happening because it is a violation of, one, human rights, but then also we know the impact, right? So the reality is that there's enough information out there that tells us that what is happening in terms of wayward public policy is harmful to people's health. Whether you're looking at physical health, whether you're looking at mental health, it is hurtful. And that as long as we allow these public policies to be implemented, to be drafted and passed into law, we're going to continue to see a downward decline in terms of the health of this nation. And so I would just offer just a greater advocacy role in making sure that in as much as we can, these policies never see the light of day. I mean, I know that this is not a formal electoral politics, but I have to say the current mayor of this city is killing people. He's killing people. Blood is on his hands. And so just two quick stories, just in regards to the role that I think people here can play. Going back to the work we're doing with the Chicago Housing Initiative around CHA reform, when we uncovered how much money, and we are talking $100 million annually, was being stockpiled by the CHA as they were defrauding the federal government, saying that they were spending all the money that they were getting from them. We attempted to take that information to the newspapers and to our elected officials to say that the mayor of the city is committing fraud. He is saying that $100 million is being spent that is not being spent, that's being invested instead, and is not being invested in people. Again, they said, you know what, that's sort of an extreme allegation. $100 million is a lot of money. What proof do you have? And so we sent them to CHA's own public records, where there's discrepancies in their own public records. Apparently they don't know how to read and write properly. And we still weren't getting anywhere. So we went to the Center for Tax and Budget Accountability, a local nonprofit, shared our data, and encouraged them to explore the data for themselves. They produced a scathing report that verified that the CHA was hiding $100 million in a line item, intentionally hiding it from discovery. They got news attention. They got attention from the mayor himself. And it was because the Center for Tax and Budget Accountability lended their name and expertise to uncover an issue that we had already discovered. The second story is when we look at the work of the trauma center. There was a ribbon cutting a couple of days ago where the new emergency department is open at the University of Chicago. Trauma unit will be in place there early next year through the work of advocacy groups and young people, particularly on the south side of Chicago. I firmly believe that the study that was produced by the Department of Public Health, which indicated that the only medical facility in the region that could do an adequate job of providing a trauma unit was the University of Chicago. It prompted them to commission their own study for whatever reason. I guess they thought they were going to get different information. They commissioned their own study that essentially said the exact same thing. And so again, maybe a year after that, they played this shell game where they said they were going to work with Mount Sinai to create a trauma unit on the South Side, then abruptly, I think to everyone's surprise, they announced they were actually going to do it. But I think the data just made it hard for them to continue to stonewall us on this issue. And so I just invite people who have the wherewithal to hold a mirror up to our elected officials, hold a mirror up to the people who implement these racist policies, to say you really need to take a different approach so that we can have a more sustainable city.
Thank you very much, Juanza. Next, I invite Juliet to share her perspective on how she came to this work and what she does in this area of preventing displacement and housing and community displacement.
Hi, good morning. So I apologize, I've been having a cold, so I might have to take a break for a second.
We're in the right place.
Right, I think everybody, right? Okay. So I think, you know, I grew up in Chicago, grew up on pretty much in the community that I work in right now. And that's such a privilege, really, to be a part of a healing process with young people, to look at the community that they're from and to have an analysis and study history together and then develop solutions that they feel really address what's going on. So when I think about my own growing up, you know, in West Humboldt Park, 80s, 90s, with the crack epidemic, with most of the men in my family in prison, right, or on a corner, how that shaped my life, and then the generation of the young people that came after me came into a community, right, who were living with the effects of men being gone, of violence kind of being the norm, of a lot of the infrastructure and the resources, our schools not being invested in. And that was their normal, right? And going through metal detectors every day, and I look, and I stand behind my young people going to school, and they're literally stripping off their earrings, taking off their belts to go put it on a conveyor belt, right, to get into the school. And I think, imagine a lifetime of that, what that says to you about who you are in this world, right? And so when we decided to begin organizing with Logan Square Neighborhood Association, you can't say Logan Square without saying gentrification, right? Like, it kind of is the poster child with Pilsen and other neighborhoods in the city about what gentrification. Logan Square has, right, the reputation of being hipster capital of the US, and so that's where we're from. And so our young people have this interesting analysis to make, where they have grown up in a time of disinvestment, and their schools literally losing millions of dollars every year, right? So I think about Kelvin Park in particular, West Logan Square. In 2012, when we decided, the young people said, we're gonna work on gentrification, was because they lost $4 million in their school budget. Right, so they were losing their coaches, there was no transportation to go to games, and they said, we understand we need to be fighting against these school closures and these school budget cuts, but we also need to fight the loss of our homes, because we're not gonna be here soon, right? We can't afford to live here, and they go hand in hand. When you think about Inglewood losing 4 high schools, but then no high school is gonna be open for at least another year, that vacuum is happening for a reason, right? Disinvestment goes with gentrification, right? Because it's land speculation. So the disinvestment at Kelvin Park High School, where you completely leave this high school on crates, right? There is nothing, no program that enriches and asks our young people to dream big about the world, right? It's basic math, science, reading, maybe substitute, and everything that really excites young people, that has been cut. There's nothing, right? It's the school of we don't have it anymore. Really, that's how our young people talk about it, right? Well, we don't have that anymore. They don't have a library. They don't have college coaches, any of those things. They haven't had them for years. But when you create that in a community, then people start walking, right? They start leaving. And then those houses are for sale, right? And so you think about this connection, and I really think the man who told us at the end of the commentary was like, well, what's the connection to the disinvestment? Like, shouldn't we be talking about the disinvestment in Black Chicago? Yes, but in our disinvestment, and our trendy, gentrified neighborhoods, we're completely connected, and I would love for us to continue to have these conversations about Black and brown experiences in Chicago, because we are being pitted against each other, right? And we're being told that the solutions that we propose, so that they won't work. Like, oh, you'll never get African American communities on the South Side to agree to this policy because you have different experiences, but these are politicians telling us this, right? They'll never listen to you. No, we need to start talking to each other, right? Our young people are the ones literally dying, right? And so I say all that to say that a lot of my work around gentrification or anti-displacement with LSNA is one, storytelling about who owns the narrative of our community, right? Who owns the narrative about what happened to your school? How do we talk about that and also add the history component that you may be missing, right? A lot of people think the hood is the hood because we don't know how to take care of stuff, right? So even beginning to talk about urban renewal with our young people, to talk about the Great Migration, to talk about how segregated Chicago has been designed to be, that the Chicago Realtor Association actually created a system for segregation that a lot of Midwestern cities actually follow, right? So that they understand that it's not because their people don't have the capacity to know how to live in a community and create a healthy community, but it was designed that way, right? And then even despite all that, even despite the disinvestment in their community, that our families bought homes, and that our families became volunteers in schools, and that our families still looked out for each other. Like, our families were survivors, right? You were not victims. So to shift that narrative for them, first of all, because you have to believe that you're worthy before you're ready to fight. And then get them to start telling their own stories, because otherwise realtors, we hear it left and right, realtors and developers love to tell the story of Logan Square and Hermosa, right? That it was nothing before they came, right? And so I work with young people on Saturday mornings, and we do genealogies. When did their family come to Chicago? What was it like? Where did they come from? Did they even know the town in Latin America that they came from? And then we talk about, what did they come here to do? What work did they do? So that they begin telling themselves powerful stories about who they are in the world, right? And then they're also involved in policy change, because it's important to tell your story, and then it's important to now, like, okay, let's go into the world, right? And do it simultaneously. It's not one or the other, or one after the other, right? It's a conversation that's constantly happening. So our young people took over the streets last summer, blocked Pulaski Avenue in the middle of rush hour when everyone's trying to get home in a hot summer. People with no ACs like me, I never have ACs in my car. And blocked it and said, we're going to inconvenience you because our families don't have homes. We can't afford to live here anymore. And made it so that Lily Santiago, the 31st Ward new alderman, had to finally agree to a community-driven zoning process. And our young people have become experts in zoning changes. I don't even know it. I don't even try to know it. They know it. And they're able to go into meetings and talk about how zoning needs to change. And I'm looking at, hello, Ms. Maggie, who actually taught our young people zoning so that I didn't have to learn it. And so those tools that they have so that they can go and disrupt tables, or not that we want them to be a part of these tables, we want them to disrupt these tables where all these deals are happening and use the language of the oppressors to turn it back on them. So they've done that. They've helped to shape the 606 preservation ordinance, which says when a developer comes into this community who right now is trendy and hot, and you want to knock down our affordable rental units, you have a price to pay. We're going to charge you $300,000 because that's what it costs to have an affordable unit. Right. For each unit you knock down, that's what you're going to have to pay. And if you don't want to pay it, then don't knock it down and leave the existing property as it is and let families be. Of course, because that's anti-capitalistic, it's being fought. People don't want it out of committee. The mayor actually then produced a supposedly improved ARO, right, an affordable rental set-asides, in his mind, but actually people are using the affordable set-asides, right? So when a development of over 10 units is built in Chicago, there's a law right now that says you have to have 10% of them affordable or in lieu, right, paid into a trust fund. And a lot of people do the in lieu, or they create a really small unit, right, for a one-bedroom or what do you call those? Studios, which are not meant for families, right? Which is actually in violation of the spirit of the law, right? That we would have to keep affordable rental units for families. And so what the mayor's proposal was, well, we'll just increase it to 15% in gentrifying neighborhoods. which we know is not enough because it'd just be 15% of more studios for hipsters, which is not at all solving the problem. So anyway, so for me, it's about who we are, the stories we tell, and then use that, that knowledge to really create some policy change that really will, that has to really confront the idea that capitalism is all, the be all end all. That of course you should sell your house for the most amount of money, and that is the most logical thing, but we're asking people, no, the most logical thing is to create a community where our young people can live and thrive.
Thank you very much. Thank you to each of you for your opening. That's actually a good segue though into the next question I have, and any of you can take this one on. A question I believe that Juliet, you may have posed when we spoke with you before, when Tiffany spoke with you, which is, what does the opposite of gentrification look like? So I wanted to pose that to any of you who wanted to take that question on.
Okay. So that's a question actually that was a driving force. So LSMA, Local Square Neighborhood Association, is working with a lot of community folks out there, and a few of them are in the audience, to create a plan for West Logan Square and Hermosa that is trying to preempt gentrification. It's trying to take the lessons that we learned painfully on the east end of Logan Square and trying to create a difference on the west end of our community, which is still largely 90% Latino and low income. And so that was our driving force. What does a community look like? What can our community look like if it wasn't strategically being disinvested in by our government, right? And the institutions around it. Because the hood really develops because of a strategic disinvestment, right? And so if we can create a strategic investment for our people, by our people, what would that look like? And so one of the things I'm sitting on, actually I'm on the health committee for this team of visionaries. And so we're looking at health as really an anti-violence strategy, right? How do we create enough connections between people? How do we create really public spaces where people feel like they can be out and safe and exercise? How do we promote mental health wellness within a very traumatized group of people, whether because of immigration or because of violence, because of poverty? And so we're asking these questions, but then how do we not create triggers for gentrification? The 606 actually, so the 606, has anybody been jogging up on there or riding bike? And it's really cute, I know. So I want to give credit where credit's due. What we call it that, we call it the Bloomingdale Trail, and that was born out of the house, the living rooms, the salas in Spanish, of mostly Caribbean migrants who sat down and were saying, you know, that railroad, that abandoned rail line is really dangerous for our young people. There's a lot of stuff happening up there. Could we reimagine what we could do with that? Can we make a park for our kids? And those were Dominican moms and Puerto Rican moms, right? Working class folks who've been there in the community, who actually bought houses along the abandoned rail line because it was really cheap and nobody wanted to live up there. And that idea started getting more and more attention, and then Obama Manuel caught on, and it caught on fire, and some of actually those original folks who helped to organize that, their original idea, were displaced because of the 606. So, I tell this story because one, the 606 is there, but so that's an example of how something can be then, that's created by the community, could then be used against a community. And so we're trying to be very mindful about how do we create improvement and connections, but not make our community much more of a commodity, right? Because everybody we need to have many ordinances, but yes. Thank you. So I could talk a lot more, but I'm gonna let Juanza and Roxanne talk.
So the opposite. I think the opposite is a very common sense notion of allowing a community to thrive, right? The idea of balanced development, the idea that you can have investment in community and not kick people who live there out. It's a novel idea, but it's something that we could very easily do. I mean, Juliet said that the hood was created, right? When we look at the zoning maps of the 1920s, a decade before some of the FHA redlining maps were created, in Chicago, you saw intentionality behind where they wanted black people to go in this city. The zoning map, right? And so if you go back to the 1920s and track populations up to now, I mean, Dr. Smith essentially did it for us this morning. It hasn't looked much different. So if you look at where black people were living at the turn of the century, you know, right, just say 1910, you saw people draw on a map, okay, this area will be zoned for high density. Then you had the redlining maps that came after that. Then you had the creation of the public housing developments, right, in the 50s coming forward, where you had people segregated based on the zoning maps that were created in the early 1920s. And then you look at where investment goes in the city, right? Someone was talking about the northwest side of Chicago earlier, and how through the zoning, redlining, federal and local policy, you have communities that have been created that will thrive in perpetuity. Policy is a double-edged sword. I mean, we fight for policy reform because we recognize the impact that bad policy has in our communities. But take the Affordable Requirements Ordinance, right? Our elected officials have figured out how to use a tool that was designated for good and turn it into something completely different. When we look at the history of not just this country, but the world, right, we see the use of public policy to marginalize and exterminate people, right? The Jewish Holocaust was public policy. It wasn't just the act of a maniac. It was someone taking their thoughts and beliefs, legislating it to legally exterminate people. And what we're seeing as 400,000 black people have been pushed out of Chicago since 1980 is the systematic removal of low-income and working families from this city, and in particular, people of color. As Latino families are pushed further and further west in this city, they're going to find themselves out of the city as well. In Austin is west side of Chicago, where my daddy still lives. There's been a 20% decrease in black households, but an 80% increase in Latino households. Why? People are struggling to find some place that's affordable to live. And so what's the impact? Now that tension, that black-brown tension is exacerbated, right? Because people are saying, my neighbor who used to look after my children doesn't live in that apartment anymore, a Latino family lives there. They must be the reason why my neighbor no longer lives there. When the reality is that Latino family lives there because they got pushed out of their neighborhood. They got separated from their roots, right? And so the reality is all of us are struggling against a common enemy. But if we don't have these opportunities to have these conversations and engage in fights together, we never recognize that we're in the same fight. And the people who are pitting us against, who grew up in Chicago? a ton of people in this room. Thank you. All right. I'm from Maywood, so it's.
Oh, I'm sorry.
Whoa, what was that reaction about?
Okay.
We need to pause this forum.
Take the mic. Take the mic.
Childhood home of Fred Hampton. I'm very proud to be from Maywood. So anyway, when so I'll stop. I just want to make a point. When we really have to take a serious look at what's happening, right? In the same way that we can find someone instigating a fight back in grade school or high school when we were growing up, just to see what would happen if this person fought that person, or you didn't like that person, but you were too scared to fight them yourself, so you got somebody else to fight them. We're seeing the exact same thing happen now. And we need to wise up and recognize that we have more in common than we have separating us.
Roxanne, do you want to take that question?
Wow. Well, I believe that everything that needed to be said was said, and what I wanted to say, he took it over here. So.
I'm sorry.
But it's okay, because we're all on common ground. You know, it just shows that we have more alike. You know, we're more in agreement than we really thought we were. You know, because there's not as I was telling my other community leader, there's not a silver bullet solution to solve the housing problem. But if we come together, your strategy can be just as good as the other person's strategy. Amen. And collectively, we can do something about this, because we sure can't take it like it is. The way it is now, no. I've had enough stress. That's enough. Okay, and when I say enough is enough, they say with a real Roxanne, please stand up. Yes, I will. Yes, I will. You know, because enough is enough, okay? And we can do more collectively. Once again, doesn't matter what the color of your skin is. But we have to stand together. That's the only way it's gonna work. You know, and fight for what's right. From the West Side community, the Maywood community, the Logan Square, every community. There's so many changes that have come about. You know, when you're used to living somewhere, you know that's where you grew up, your community. Even CHA, what you were talking about, from 1955, when they started CHA housing, you had people come in. My mom had 12 kids, I know. Okay, we were there, right there. But it all changed. Then they just swept us away, tore down the buildings. I come back from California back here, and it's, where they at? So something has to be done. Affordable housing is needed. Rent control is needed. It's time to stand up and do something about it. We can't just talk about it, we have to be about it. Okay? That's all I have to say about that.
Thank you for that. That's a really great segue into the question that I have next for all of you. So I'm going to throw out a little bit of public health jargon for those who work in public health. The World Health Organization's framework on the social determinants of health situates power as essential, and power building as essential to advancing progress on the social determinants of health, which are the living conditions in which people live that impact their health. And so I consider gentrification as a structural determinant of health inequities, meaning it determines the distribution of money and power and resources. Could you talk about how so we'll get into the specifics of what policies we need eventually, but how do we build power to change those inequities? How do you do it, and how can we do it collectively better? What are your visions for building power to stop community and housing displacement?
I think we said earlier, coalition building. I mean, we at the Kimmel Oakland Community Organization, community organizing is our primary methodology to create change. Communities have to be able to operate as communities. The whole notion of a community implies that there's relationship between the individuals that live and work there. What we have is a situation where community has virtually been extinguished in our city. People don't have the opportunity to really, truly relate to each other anymore. People are working 2 or 3 different jobs, right? Let's just take a random poll here, right? People in the audience. The people that you work with, on average, how many hours would you say you spend with them? Just toss it out there. Your coworkers, how much time in a day do you spend with your coworkers? 8 hours? 10 hours? Oh my goodness.
Wow.
Anybody else? 8, 10? This is a shy crowd. Okay. They're tired? Talking too long? All right. All right. So 8 to 10 hours coworkers. How much time do you spend with your neighbor in a day, on average? 0. In the elevator. 2 minutes, right? All right, and so that's a problem. And so part of what we do in our line of work is we recognize the problem and develop a solution for it, right? The solution usually is pretty close to the opposite of whatever the problem is. And so if we have a situation where the majority of our time is spent with our coworkers, how do we identify time to be able to relate to our neighbors? People are experiencing the exact same thing that we're experiencing. If they're having problems with their children, chances are your neighbor is also having problems with their children, right? If I can't afford my rent, chances are my neighbor also can't afford their rent. If my school is closing, guess what? My neighbor's school probably is also closing. And so as we create opportunities for us to talk to each other, we also create opportunities for us to develop common solutions to deal with our issues. And then enough is enough, right?
That's right.
And so if we're able to band together with a solution that we've developed, a solution that we own, we're going to push for it. And when we have people push back against us, we have the legitimate right and the wherewithal to continue to apply additional pressure to make sure that what we cooked up in our living room gets implemented by the people who are supposed to be representing us.
That's right.
That's the only way to fix this. We have to be willing to find the time to work with our neighbors, to work with our families, and challenge the people who get paid to represent us, who choose, for whatever reason, not to represent us. That has to be fixed. That's a serious problem.
Thank you. Roxanne and Juliet, would you like to take that on?
When he talked about, okay, go ahead.
No, I wanted to ask, I know that Northside Action for Justice is really a grassroots organization. We don't get funding from any organizations. One Northside does. And they have people that they can pay and stuff. We're mostly all volunteers, and we do what our community, our members want us to do. Period. How many other groups are you aware of
That are like,
Yeah.
I'm not loud enough. How many other grassroots organizations like Northside Action for Justice are you aware of? I think that's what we need, because we, when we talk about banding together, we need we need grassroots, because that's where we talk. And then band the grassroots, and we grow. And we love you guys. So, anybody, can you answer my question? Are you aware of any other grassroots organization? Yes?
Oh, there's almost Logan Square. There's another grassroots organization working on, and there's the Albany Park Autonomous
Tennis Union.
Tennis Union, there you go. So there's a few other grassroots. I'm talking about Northwest side. Okay.
Yeah, I'll just say that largely through the work that we've done with groups like Northside Action for Justice around public education reform, the work we're doing fighting for affordable housing, we've uncovered a lot of these smaller community-based volunteer-ran organizations that have really come together just because they don't have any alternative. You know, they see themselves being disinvested in, and they are fighting back. And the issue is, right, the sustainability of it, right? I think Northside Action for Justice in particular has done a phenomenal job being able to resist and survive. It's not that easy to continue to resist and survive. And so I definitely want to just applaud the work that you all are doing, because it's been just phenomenal in terms of pushing back. I think Uplift High School is a beacon on the north side in terms of how you bring social justice philosophy into an educational institution and withstand attacks from the district as they attempt to marginalize and eliminate dissent from within the city. I mean, it's happening in our schools. This notion that we have to eliminate dissent from the public space starts in our schools. Our children are being penalized for questioning what's happening. And we have to stand, as adults, we have to stand up and protect our babies. We can't allow this to keep happening. We can't. Every time you hear about a school being closed, you always hear about a young person losing their life because they were in the wrong neighborhood. And our elected officials, our appointed officials, the people who run these institutions aren't stupid. How many times do you have to hear that a young person was killed because they were in a different neighborhood than where they grew up to say, maybe we need to do something about this. Maybe we need to stop putting children in harm's way. Maybe we need to invest in these communities instead of disinvesting in them. Maybe we need to figure out how we can have the same specialized provisions on the south side and the west side as we have on the north side. Does anybody remember when they had autonomous schools on the north side where it was written into the school policy that class sizes had to be small? That it was an actual experiment where they maintained small class size to be able to give more individualized attention to the students and to have a whole school environment that really supported each other. The teachers were able to support each other. But that never happened on the south side. That never happened on the west side. At Mollison, which was in the news recently because it was overrun by rats, we had 42 kindergarten students in a single classroom. 42 kindergarten students in a single classroom with a single teacher. No teacher aide.
That's crazy.
And these young people are entering school for the first time, many of them. A lot of those students work in the Head Start program. So their first introduction is learning their ABCs and 1, 2, 3s with 40 other students, all vying for that attention from a single teacher. And then what happens throughout the rest of those primary grades as the class size shrinks modestly? So instead of 42 students in the class, now you may have 38. With no teacher aid, no additional resources. So, I'm sorry, I get passionate.
We want that, so thank you for that. Does anybody else want to take that on before we bring up our other speakers and go into the discussion session? Somebody? 1 second. We're gonna go ahead and bring them up then. So we'll have Janet and Chloe rejoin us.
Hi, my name is Gail Schechter. Thanks for this great set of presentations. And I want to piggyback on what a couple of you on the last panel talked about, which is that it's all about public policy that codifies values that are destructive. And when we talk about gentrification, it's really all about the playbook of following the money. And I think all we have to do if we're talking about trying to stem gentrification, displacement, is just steal a page out of the playbook of the suburbs, because that's what it's all about. You have home rule, so you make sure that the dollar stays in the community, it never goes out, that homeowners are able to keep the money that they invest, equity grows, dollars recycle within. And so that's some of the policy that we can, those are the sorts of policies that we could try to do in neighborhoods. But before we can even do that, I'm just wondering what you think about other ways to try to keep those dollars in neighborhoods. Things like community land trusts or businesses that are locally owned. So, just wondering about some of your interim thoughts until we can get the bigger sets of public policies changed. What do you think about some of those local ownership ideas?
Yes, good. So local control, and I think is what you're talking about, and control of the land is clearly something that we need to think about. It's interesting to talk about control of the land given the fact that we're on land right now that we took over from some people who believed in not owning the land. I just want to say I'm struggling with this a lot these days. But in our world of capitalism and the way land works, if you don't want it to be a land grab, you have to prevent it from being grabbed, right? And so community land trusts, which we have officially won in the city of Chicago, the first community land trust of Chicago, which was created in West Humboldt Park. We helped back in the early 2000s to help create that. It's part of the Humboldt Park Quality of Life Plan. It unfortunately sort of suffered the recession in terms of some of the efforts to try and build out there, but it exists. The city of Chicago supposedly has a land trust. You can ask somebody in the city of Chicago to explain it to you, because I don't get it. It was a voluntary process rather than putting housing into it automatically, and then they did start enrolling housing. So if you, just to think about this, if you put public dollars into building affordable housing, wouldn't it make sense to then say, in perpetuity, we're going to keep this affordable? So for a long time, Chicago didn't think that was an issue because we were building in Pilsen, and Pilsen wasn't gentrifying. We were building in Humboldt Park, it wasn't. And suddenly I'm like, oh wait, gentrification. Oh, so now people, at least we're recognizing that that's a strategy, but the city of Chicago, that's not, it's a policy, but it's not one that they actually do much with. So I think we need to maybe hold them more accountable for that, and really be serious about how we can not just put the little bit of housing that we build with our public dollars, which is not that much anymore. We're not able to build much. It's too hard. It's too expensive in Chicago. We heard $300,000 a unit. But how do we get more housing like Burlington, Vermont did over almost 50 years ago? Burlington, Vermont, which is the largest community land trust, it's the city, the whole city, and it's serious about it. What they've shown is that if you have a housing in perpetuity to be affordable, the idea is that the same price it cost in 1980 to buy that house, in 2010, it would be the same price for that same income group. So if you earn $40,000 a year, then thinking about $40,000, what you could buy in 2010, it'd have to be the same amount. They've proven that they're able to keep affordable the housing in perpetuity, right? And so what we know is that's important because housing values have gone up, rents have gone up, income hasn't gone up, right? So I think we know it's a tool that works, and we've got the tool in place. I could make a joke about a different tool, but I won't, but we have to think about how we actually make a mayor and the city council put that tool to work and be aggressive about it rather than be just sitting there and waiting for something to happen. So I think we've got the tools already to do that. And we know that they work. We've got evidence, right? We've got evidence from research that's been done on land trusts that shows this is effective. By the way, it's also effective at helping people prevent or minimize the likelihood of going into foreclosure. That because the way the land trust works with a homeowner, who by the way is often lower income than the market rate homeowners,
they're more vulnerable. And during recession especially, the research showed that they were actually able to stay in their housing, not just because they were in a land trust house, but because what came with the land trust, that community, that group of neighbors, the people that Joanza was talking about, that were there, the safety network, the support that was needed to intervene and to say, how do we work collectively to prevent you from losing that house? And so we have to look at it as the community part of it, not just the land part of it.
I think even on a smaller level than that, so our young people have, as a result of one of the newest buildings to be bought out by developer Mark Fishman in the community, who's been responsible for displacing thousands of families in Logan Square and Hermosa, maybe somebody here in the front, and Avondale as well. And so then he bought up a 30-unit building. There were only 11 families left because little by little they weren't replacing the units when people moved out. And so we had these 11 people, and a lot of children from one elementary school, Darwin, who would be displaced, right? They had 30 days to move. They got a notice, he bought the building, you need to evacuate. And so sometimes we ask ourselves as our young people, right, they're thinking, what can we do immediately? And so one of the things they're doing is walking the streets and writing down the names of all the for rent signs and talking to those landlords to ask how much are they renting for, to see if it's affordable, and to see if they're interested in joining an informal network of landlords who see the value of renting to other families in the community affordably. And then from there, seeing what more can we do as an organization, as a community, as a city to invest in those landlords and support their work. So that's what it looks like in a microcosm. And then also thinking about homeownership, I think a lot of times like our tagline is Homo Park no se vende, Pilsen no se vende, right? It's not for sale. But in reality, like that's like trying to stop, right? It's trying to stop capitalism all at once. And of course I want that. But in reality, things are going up for sale, and it's a natural process, right? That people are going to get old and they're going to want to move to Florida, like every Puerto Rican family, I know. And so that's going to happen, and so then, okay, so that house is going to be vacant, but then how are we preparing, 30 and 40-year-olds or 20-year-olds from that community to be in a position to buy that home and be for a developer? And so there's a group, Center for Changing Lives, who's working with lending circles, and for Mexican they call them tandas. And then, so as a way to build credit, so that if you participate, let's say, in a 6-week lending circle, they can report that out into the credit unions and build people's credit so they can be in a position to buy one of these homes. Unfortunately, what we're not seeing in gentrifying communities is that some of the tools that large nonprofit organizations or housing development corporations have come up with, they're not meant for gentrifying communities. They're really meant for communities where people are not buying homes. And so we're saying, in Hermosa, we want to scoop up some of these houses before the developers come, but the houses are really expensive. And they're not going for $40,000 on an auction. They're going for $200,000 or $300,000. And so some of the tools, right, are not yet in place to save gentrifying communities. And so we also need to have that conversation with the funding world, that they need to invest a little bit more to create some solutions so that we can scoop up those houses and get families in there from the community.
If I just real quick, Tiffany, I think also we have to look at the fact that these systems are all interconnected, right? When we adjusting for inflation, since the 80s, wages have gone up 7%, and productivity, how much the owner of the company makes, has increased 80%. So what owners are paying people has gone up 70%, but what they're putting in their pocket, based on whatever the product is, has gone up 80%. And so part of why we need affordable housing is because people don't have money in their pocket, right? And so if we are able to encourage our lawmakers to invest in communities that they represent, instead of looking outside the communities to go to Amazon or Mariano's or whoever to bring the jobs into our community, we'll have a much better outcome, right? Instead of bringing in Walmart where people have to still work another job to be able to pay rent who get a job there. If people are able to say, hey, I know you have an idea for a small business. Let me invest in you. When all the research shows small businesses hire on average 3 people from the neighborhood, the wages typically are better, right? In a generation's time, if this is your goal, I'm not saying this should be the goal, but in a generation's time, you can completely transform one community into a much more affluent community just by investing in the people who live there. But that's not the perspective that our lawmakers have. Our lawmakers go for the silver bullet, and they give them all of our tax dollars as an incentive to get them to come here, and our communities are left in the same condition after they get here than it was before they got here. It's a shell game, and the people who benefit are the people who are making the decisions and not us. We have to push back to say, you need to invest in us.
So, my name is Tanisha Mansfield. I have a question based on some things that were brought up and touched on earlier around Black and Brown coalition building. Because you hear it already in the narrative that's happening around shifting demographics in the city and everything. Like, the narrative is beginning to continue to pit Black and Brown communities against each other. And so I guess my question is what is needed to create like coalition and relationships between and among Black and Brown communities so that the communities can learn from each other, build power with each other? Because I feel like I'm just kind of curious, like, what is that actually going to take in this time and space where we're very place-based in our funding? I work for Polk Brothers Foundation. So funders are becoming more place-based, and which to me seems antithetical in some ways of actual bridging communities together. So I'm just kind of curious from your thinking as organizers, like what is needed and what will it take to bring Black and Brown communities together to help shift that narrative and build power in a different way? So as a youth director with youth, I mean, a lot of the work that I'm doing with Latino youth is around identity and understanding who we are. And it really was spurred around trying to get our Latino youth at Kelvin Park to understand Black Lives Matters, right? So that's where our conversation began, which then has kind of spurred on to this kind of genealogy project. And we've gotten the funds to do DNA tests with a lot of Latino youth as part of expanding that conversation and really thinking about anti-Blackness. And what we're finding over and over again is what we know historically to be true is that Latinos are part of the African diaspora. So our Caribbean youth, I think, are much more attuned to that, right? Just because of the Caribbean, and definitely much more Latino is much more of an identity, part of their identity. But a lot of our Mexican youth didn't have that understanding of themselves as part of the African diaspora, and through doing the DNA test, seeing 5, 6, 7% African, and then, wow, right? That expands the way that they think of themselves and think about relationships here and modern day problems here. So I think that, I go to it as, this is a values conversation for me first. I think it has to be trauma informed. When we talk about Black and Brown coalition building, at first we need to kind of talk about all the pain between our communities. A lot of the misunderstandings, the way that we have been pitted against each other, the narratives that exist, the narratives internally that happen in our own communities about each other. And really, I think it really looks to the point of like a truth and reconciliation kind of process. Because if we really want to get to the point where we can get and imagine a world together, it has to start with a healing conversation. That many healing conversations. I really believe it has to be that deep. Because it's about colonialism, it's about white supremacy, right? And that has to happen so that we can even build a trust and understanding between each other to continue to move forward for a different world. But maybe there are other people who think more practically.
I definitely want to second that. Part of it, a huge part of it, I've done a lot of dialogue work as well. So these cross-identity conversations and really driving home the points that everyone on the panel has been making about these things may play out slightly differently for people, but they're all part of the same system, right? They're all part of classism and racism and how they work together to put certain people in power, and they're very, very effective at dividing us. So, how do we push back against that and realize that that's part of the game, right? There are, from the kind of community-led and community-oriented development side of things, groups that are being really innovative about this as well. So groups like the Southwest Organizing Project that are actually doing community dialogue across Black and Latino communities to build up that common understanding, and then working together to say, look, we shared these spaces, how can we work together? And then just realizing that even pitting it against that on the individual level leaves out people, porque hay personas que son las dos, like me. There's people that are both Latino and Black, and a lot of us, and more than we realize because of this, diaspora that you brought up. So, yeah, I agree.
Hello, my name is Jada G. Hoskins. I'm with Health and Medicine. I just wanted to speak to her question. As a former youth, work on the Southwest side with Southwest Youth Collaborative, working in JCDC, and in particular in the Chicago Lawn area. I'm an East Sider, but going to work on the Southwest side really gave me some understanding around Black and Latino relations. I think one of the key things is what I would consider youth community-based field trips. You have to see it. So if we're taking young people to Kelvin Park High School and looking at the area, and then bringing Latino young people to Inglewood, or what's happening in South Shore, which is where I'm from, and have the conversations there, all of us, choices are circumstantial. So if you are not within those circumstances, if you cannot see it, then it doesn't make any sense. And it has to be led by our young people, because that leads to generationally out. So in having these trips, and really seeing your neighborhood looks like my neighborhood, your high school looks like my high school, I think it would bring a different conversation and really lead our young people to give their ideas about what to do, build that coalition across sides in Chicago.
I would just add to that by saying that work gives a great opportunity for those exchanges to happen, for those dialogues to take place. Oftentimes we operate in crisis mode. We can be crisis oriented. So in the good words of the current mayor, that's right. And so the idea is that, particularly right now, we have schools in Inglewood that are being closed, right? How can we use that opportunity, if we can use that word, to help have some of these cross-community conversations? How can we engage young people who've experienced school closing, working with those students in Inglewood who are about to experience what they may have already experienced, to hear what that pain has been like, to hear some of the strategies they were using to resist their school being closed, that may have worked or may not have worked. I think we really have to look at this from an organizing perspective, to be able to have these conversations that's rooted in the reality of place-based crises. I think that's important.
I want to ask something. My name is Liron. I didn't hear a lot about people with disabilities regarding gentrification and the connection to health, which affect them, I think, the most. So I would like to hear from you how you see the connection and what the data on people with disabilities.
I'll speak just real quickly about data. It's not in our gentrification index, but we did a separate analysis to look at where people with disabilities live relative to transportation, because that was a question we were looking at, in public transportation in particular. And then we looked at the data like 2 years later, and what we were concerned with is the areas that we would designate on the north side that are gentrifying have seen a decline in people with disabilities. So just like I said earlier in our index, we don't have that in our index, but it's something to think about. Aging and young people, we suspect, and we've heard this from talking to people in Houston as well, where we did some research, that typically the transportation strategies, in Houston it was adding transportation that created the gentrification that led to the displacement of people with disabilities. In our case, it's transit-rich areas that are continuing to gentrify and get into the uber gentrification, and also concurrently the loss of subsidized public housing in some of these areas where they had protections and opportunities, as well as the push out of people with vouchers at the same time. So people, more people have vouchers in Chicago than live in subsidized public housing. And so what you have to pay attention to is everyone's like, oh, well, they've got a voucher. Yeah, but that doesn't mean they can stay. And so when looking at data on the 606, for example, the mayor put out this chart that said, look, we have all this subsidized housing. And what he really showed was there were a lot of people with vouchers living near the 606, and they were living near the west side of the 606 at this point because they'd already been displaced. Now, those aren't all people with disabilities, but we know that a lot of people with disabilities use vouchers as well as live in subsidized housing. So I think the only thing that's sort of safe is some of the housing that was designated for seniors or 55 and older in public housing, because that also was where people with disabilities could live. However, the city of Chicago, or the Chicago Housing Authority, got waivers to not make those places where people under the age of 55 could move into if they had disabilities, because they just wanted them to be seniors only. And so they've excluded access to an asset that actually is pretty stable and safe. Because I'll just say it this way, do not make older people angry about their housing because they fight back, right? And then you can see this with Coco and they're organizing and other people who've organized, but what we've seen is probably the most stable subsidized housing is for older people, but we've now excluded people with disabilities under the age of 55 from getting access to it. So I think just the data suggests that we're seeing a pushing out in those communities because of whatever reason, affordability or the loss of the subsidized housing.
Hi, I'm a retired public defender and going to turn 70 in February and been an activist a long time, and I'm glad to see a progressive group talking about gentrification, because some people want to avoid that because some liberals and artsy people, we are the gentrifiers. But I think we have to include in the coalitions working class white people. The neighborhood that I grew up in, my high school just had its 50th reunion, and when people from it were touring the neighborhood, they didn't recognize it. Family restaurants are replaced by places with $8 scones and $6 lattes. So that has to be included, and I'm glad someone mentioned seniors. Seniors have to be included in the coalition, because even if you have like a private house or living in a two-flat that someone wants to tear down to build McMansion, seniors need a whole lot more time. To move, you might be in the process of even considering assisted living versus a private home. So, I think we need to reach out to senior groups and include working class white people in our coalitions.
I want to add one thing, that over 15 years ago, maybe it was, we looked at the first loss of subsidized housing in mass that happened because the Clinton administration started this process to refinance subsidized housing, and it opened up the opportunity for landlords who had built subsidized housing in places like Uptown, where it was cheap and it was low-income families primarily. And then suddenly Uptown's looking good, like, hey, gentrification. And so in this policy to refinance these buildings, the landlords had the opportunity to get out of the deal, and they didn't have to be affordable housing anymore. And what we looked at in Uptown was the loss of thousands of units that happened because of a policy change, and what most of those housing units were what we call NORCs, that is naturally occurring retirement communities, because they were people who had aged in place and thought they were going to continue living in that place, and their resource was gone. And so I think the policy finally changed after they realized that most of the people being hurt by that policy were older people and people with disabilities. And people with also mental and physical disabilities, which is important if you know Uptown's history. But I think what we have to start looking at is what I call our NORCs in Chicago, naturally occurring retirement communities, and working with folks up on the north side through One North Side, looking at the data that shows all these people who've aged in Lincoln Park who are house rich but income poor. What we were worried about is the tax increases on their homes and what was going to happen there, and we mapped it out, and it was scary. So I'm thinking about just those protections we need to put in place immediately. Some of the things that were pointed out in the earlier presentation about strategies in terms of not just rent control, but also how do you help with tax freezes and tax, helping people now.
So in terms of questions, I've got you right here, and then there's someone over there who had questions. Okay, so before I pass the mic, I just want to add to this conversation by saying, I appreciate these last two questions that we had, because, we have been having this conversation from, I think, really focusing in on the conversation around Black and Latino populations, but we have more marginalized and vulnerable populations in our city that are displaced. So I do think that there's value in understanding the way that gentrification and displacement plays out in each of these different groups. But there also is value in understanding what lies at the root of gentrification and displacement for all of these marginalized communities. So I think that as we're having this conversation about what does a fight back look like, we need to make sure that that fight back includes our disabilities community, that fight back includes our Asian community, it includes our Black and Latino communities, it includes all of the populations and all of the people that have been made to be vulnerable and marginalized in our city.
Thank you. I'm glad that you mentioned that. So my name is Lola, and I'm a nurse consultant, and my passion is community health. So I have to tell you, I've learned a great deal about the gentrification and housing and the lack of it, but I will say that most of my experience has been on the front lines in terms of dealing with patients and people who at the end of the day, they suffer the consequences of everything we've spoken about today. So I guess I could say my expertise comes more in health equity. So my question is, and I'm wondering, because I don't want to assume, in terms of a coalition and coalition building and strengthening, do any of the organizations consider working with a lot of the healthcare community groups, doctors organizations, hospitals, nurses organizations, pediatric organizations, mental health organizations, Adler, the Chicago School of Professional Psychology, Roosevelt, who all deal with behavioral health and mental health issues, and they are really strong on the front line of social justice issues. So I'm thinking that the coalitions that I've heard about, they have a really strong background in terms of the gentrification and the housing and policy, but I think to pull in organizations that are strongly related to health issues, and they already have the data in their systems in terms of the children that we see with, I go into child care centers, and everybody's asthmatic, everybody has allergies, everybody is, these are children, these are infants. The data is there. They just have to be used and have representatives from the healthcare side who are greatly concerned, especially nurses, and I don't want to brag about them, but anyway, but in terms of what they deal with and how they don't, my mind, and that's what part of why I attended today, is my mind is so encased in healthcare that I have to expand it to understand that why it ends up and why we have children like this, and housing and living in unsafe situations and being exposed to chemicals and living next door to God knows what, and the list is endless. And so just like our community outreach worker, I'm sure she sees the same thing, and so this is part of it. So these groups really should be at the table in terms of advocating, and they have the ability, the credentials and the data to support that this is where we need to be trying to invest. So that's something that I just wanted to put out there because for myself, I mean, it's been a new paradigm for me this morning, and I really greatly appreciate it because now I see there's a lot of work to be done.
I'd really be interested in hearing if any of your coalitions are including health folks, but from just adding to your point, I think that's a really, really important strategy, not only from the data side of it and the power that can come from that, but also on the communication side and advocacy side. We know that both from a community level and from kind of the top-down, like policy makers side of things, people really trust health professionals and health providers and believe in what they say. And so I think we don't always see that, we don't always own that as health people, just how powerfully people trust us, and that if we say and get out there with this is hurting people's health, that people really care about that and really will take it seriously.
I would say, so as a community organization, we have many arms, and part of it is in schools and having parent and leaders, and so we have partnered a lot with Adler and different health clinics and universities. But I would say too, I don't know if the folks are still around, but we have a planning body that really is looking at different aspects of our community. So making a 5-year plan for our community, and we have a committee. One of the committees is the intersection between health and gentrification, and where we're having those conversations about what does wellness look like, and how do we keep people in the community and stem displacement and wellness in a very broad sense. So on that committee sits mental health workers from the YWCA, Prime Care, Community Health, I don't know if it's still here, a health writer, Jim Daly back there, and also people from cultural centers who are thinking about wellness and right as movement, and also the connection to culture. So really celebrate knowing your culture as Latinos in the community, and so we're having these kind of conversations with folks like that so that we can expand our networks and understanding of health. But
for us, it really depends on the issue area. Talk briefly about the work we were part of with the Trauma Care Coalition to fight for a trauma center on the southeast side of Chicago. National Nurses United was a big part of that fight. There were a number of doctors, surgeons, some of whom preferred to stay sort of behind the scenes, who were huge advocates internally, in particular in that fight, and helping to get us information about what was happening in the University of Chicago with all sorts of things that we could bring to the forefront that they wanted to hide behind. With the hunger strike that we were part of for Diet High School, there's some people in the room who were part of that fight with us in a number of different ways in terms of direct care for the people who were starving themselves, who had literally put their lives on the line to ensure that we had a decent high school in our neighborhood, and people who helped in the lead up to it, nurses and doctors helping to get those people prepared for what they were going to encounter. I have a meeting coming up next month related to our rent control campaign, where people recognize the connection between housing and health and want to figure out how to help people stabilize their lives in a way that's sustainable, that promotes good health. So it just depends. Some of our work with our young people, there are medical professionals who are involved in that, looking at every aspect of it, where you're looking at substance abuse, you're looking at mental health, where you're looking at restorative justice issues and the impact, the broader impact of what that means. How can we operate in a community that has a restorative approach to life? So it depends, but we are definitely, anybody in the room who's a medical professional who want to work with us, I want to work with you, so let's talk.
I'm the last question. I'm Lakia again, the AmeriCorps person. So I just want to be an advocate for a second. I want to thank all of you guys. I've learned so much, like a lot. And also to you, Juliet, because people like you is who I am today. I was in AmeriCorps, I was in Overbound, and I think that really helped me with like the process of school itself. And I got to meet a lot of different people from different schools. I went to Gwendolyn Brooks, the old Mendel the older folks. And I went within my Overbound, I got to see people from like Corliss and Finger, and it was a culture shock to me because they were, they were different, I'll say. So I'm grateful for that because it opened my eyes. And, mentioning the metal detectors, like Gwendolyn Brooks is supposed to be this wonderful school, beautiful, but we had metal detectors. And I didn't think about that, like how it could impact people. It didn't impact me. I'm glad that we had metal detectors, protect me. So I understand that. But also my question is, I've lived in like 10, 11 different places all over the South Side. And my mother always told me, oh, it just wasn't this or that. So this is bringing light to a situation. You can't really explain things to your kids. And it explained a lot. I have a lot of different memories in different neighborhoods on the South Side of Chicago. So, but what do you have to say about the reverse migration that's going on right now? We know the issue, we know what the problem is, and we're supposed to be fixing it. Why are we having reverse migration right now within the city?
So this is something that some folks on the cost of segregation team and housing team at Metropolitan Planning Council have been looking into as well. I think it stems from that disinvestment that we see, when people moved here during the Great Migration, they were immediately segregated, right, into these neighborhoods. So yeah, they were coming here to escape something, but were put into neighborhoods where then over time that's been disinvested as well. And so we know that for one of my colleagues did some analysis about where people are moving when they're leaving Chicago and leaving the Chicago metropolitan area, and a lot of them are moving back to areas that now are less segregated, have better job opportunities and things like that. And so I think it's just, this continued either inability or unwillingness to invest in making changes that are necessary for supporting people, and people are responding to that.
Thank you for such a robust discussion. My name is Venencia. I am a community psychologist. I'm really glad to hear the intersectionality of all of the other populations that aren't necessarily represented on the panel, but have been represented by participant comments. And so I'm going to add another one into the mix. Oftentimes, the LGBT community is considered to be gentrifiers, but we are also simultaneously gentrified. And we've seen a pattern of gay men not being able to afford Lakeview or Boys Town, moving into Andersonville, which was traditionally LGBT women's area, and then displacing us, moving into Rogers Park or moving west into Portage Park areas. And so it brings in a lot of intersectionality based on ethnicity, based on gender in terms of wage gaps in gender, also lifespan issues, because LGBT youth, particularly trans queer, tend to have the highest homeless rates. And then if you go to the other end of the spectrum, looking at seniors who may have to face going into assisted living or nursing homes and end up going back into the closet because they don't feel comfortable in the areas in which they're forced to move into. So I just wanted to bring the LGBTQ community into the conversation as well. Thank you.
Okay, we're going to close out with one last question for each of you. I'm hopeful that each of you will kind of go down the line and talk about this. So what is the one either policy change or other change you'd like to see in the next 3 years that would advance this cause of slowing or stopping community and housing displacement?
Well, I believe the city needs to develop a plan to preserve affordable housing. We need to get a plan, develop a plan, especially in our 2 and 3 bedroom apartments for families. We need the city to invest resources for that, specifically in the preservation of our 2 to 4 unit buildings and courtyard side buildings, to be creative. There are people with families who have disabilities. And my son shouldn't be scared to come home on pace. And the driver shouldn't take him all the way around the block. I don't care if he is 30. That's my son. And as long as our kids are our kids, that's your baby. Okay, it doesn't matter how old they get, that's still your baby. And we want the best for them. And if you don't invest in it, how are you going to get anything back? You have to put something in. And there needs to be strategic in the investment. You know, if we take a look at the figures, and I've heard from everyone on this panel, everyone here, there's a lot of things that can be done. But we have to come together and use that strategy. It's not a silver bullet to do it, one-shot deal. But we have to organize together and come together and do this. That's my approach to
So I don't know if I can pick out one strategy that I think would do it. I think, is this supposed to be like one that we really think is going to be able to be implemented, or one that
dream big?
Okay.
Dream big.
So yeah, I think I would really like to see something that Juliet was talking about in terms of a real serious kind of redistributive policy that says if you're going to do this, then you have to jump over this hurdle and then pay us back, and then and all of these things. And I just appreciated your point so much about the 606 as well, Juliet, because that was a perfect example of what I was trying to say earlier, of why community involvement and it being community-led sometimes isn't enough. It's not because it's not enough in and of itself intrinsically, it's because our system doesn't value that enough to give it the weight that it deserves, right? So, thank you.
I'm going to cheat a little bit, Wesley. In addition to seeing more accountable and transparent elected leadership, starting with the new mayor of the city, I think if we had a citywide policy that attached community benefit agreements to large-scale developments, we would begin to see the city transform in more productive ways for communities. Part of what we're pushing for with the community benefits agreement related to the Obama Presidential Center incorporates a lot of the ideas that we've talked about today, particularly in the housing portion of it, where we call for a community land trust, where we call for rent regulation, particularly in that area, where we call for property tax freeze, etc. The reality is there is no one thing that's going to fix this problem. I mean, when we look at the opposition, it wasn't just one thing that they did. They created one thing, they created a pathway, and they continued to lay additional bricks along that path to get them where it is that they wanted to go, where they could live a life where they didn't have to interact with somebody they did not want to have to interact with, in essence, right? And so how do we begin to create policies that do that for us, where we have the opportunity to create the communities and the life that we want to have for ourselves? And I think community benefit agreements in general can help to do that.
Yeah, I agree. It has to be a citywide responsibility that says we want a different Chicago. We want a Chicago where segregation is going to be tackled. We're going to deal with it. We're going to end that history. That we have a responsibility to each other to create the conditions for integration within our communities. And so, and I mean, that means economic. It means all the different lenses that we've been talking about, right? That the participants have come in. And so one idea, and maybe it's the best, but it's one that got me excited when I was looking up late at night, different city solutions. And I know Seattle has its own affordable housing crisis, but you know, this idea of creating a fee that all landlords pay into an affordable housing trust that says it's important in Seattle that we should create some affordable housing in the middle of all this wealth. And so it's an average of $65 a year, which doesn't seem like a lot, right? For a landlord, and that goes to this pot. And then there are, I think it was like 5 different initiatives that money went to support. One was helping low-income landlords continue to rent affordably, so helping them keep up their properties. The other one was it was a pool for single mothers to be able to rent affordably in their children's school district. Awesome. There was another one for first-time home buyers, another project, so that they can get people who grew up in Seattle into homes in Seattle, right? And so there were a number of different initiatives, and to me it seems so almost too simple, and I'm not the expert, so you would probably tell me it doesn't work, but it made me excited about that possibility.
So my view of it is always start with the tools you already have and make them work. We have a lot of tools that we don't use. So we have a low-income housing trust fund in the city of Chicago. How many people knew that? Right? No, it can't. It can go anywhere it wants because it's supposed to go and help low-income renters live in an apartment. So what we have to do is we have to get it funded. We also have a state-level trust fund, which tends to get robbed every year by elected officials. But I guess what I'm trying to say is that if we start looking at that tool and make it stronger, right? And I think one of the things is it's sort of hidden because everyone's like, well, we don't want the city, it's not quite the cities, it's sort of quasi-governmental. Well, we don't want, we don't want it to get taken over, and we don't want it to go away. And I think that's there's a lot of concerns there. So I'm advocating looking at the tools we already have and strengthen them and use them well. I think that's another thing. Sometimes we have these tools and we're not. So right now that tool is to help 0 to 16% AMI. I'm talking people with no money to very little money with rent. It pays the landlord the rent, and then it helps people who are 16 to 30%. So basically up to 30% of AMI, which is very low income. That's poverty level in Chicago. And so I've done interviews with people who have benefited from this, people all over the city. And actually, when you look at it, it's probably better than the voucher program in terms of integrating people. And it's maybe 3,000 or 4,000 households are benefiting from it, but that's 3,000 or 4,000 households that are not homeless. So can we double that with the method that you're talking about, right? In terms of just getting everybody in some way to pay into it. That's the trust fund at the state level works by a real estate transaction tax. I was on that fight to get that thing going, and we did not ask for enough money. But if you look at when you look at transactions, if you just put a little bit of money from each transaction, it builds up, right? I mean, we're learning this when we think about a lot of things. We're like, just a few dollars from everyone is not the same as asking for $5 million from one, because you're beholden to one versus $5 from everybody means we're beholden and responsible and accountable to everyone, right? So I think if we start looking at that, it's how do you tax equally all the different properties? We ignore. I had to have a conversation, and I'll be done in a minute, with somebody about how we focus on getting the money for affordable housing out of housing developers. And what do? They complain that they sue the city of Chicago. So this is what's happening with the ARO and some of these other tools. So somebody said, well, why don't we look at taxing those people who build other buildings, like office buildings? There are strategies. San Francisco introduced that in the 70s. And people tried to get that in Chicago, and we didn't get it. But if you start thinking about distributing that, and there's a lot more office buildings, a lot of them being built. I'm not sure if they're going to fill up, but if you start thinking about how you bring in more people into this conversation, because why does it matter to have affordable housing for office workers? Because they need to live somewhere. A lot of this, the buildings we're building, the pay for people is not that high for many people working those buildings. secretaries and such like that, just thinking about that. So I think we need to get more creative with the tools we already have, and we need to get more money into those pools so we can deploy them. And I like your ideas. Thank you.
Wow, great. Thank you so much. Can I get a round of applause for our great panelists?